Good morning, everyone, and thank you all for joining us here today for the first ever Tri-Collaborative National Sickle Cell Disease Policy Forum. My name is Regina Hartfield, and I am the President and CEO of the Sickle Cell Disease Association of America, Inc., or SCDAA. We are so excited for this opportunity to co-host the Tri-Collaborative event alongside Sickle Cells and the Sickle Cell Disease Community Consortium. We believe that when our community is united, we can facilitate tremendous progress towards improving the quality of life for families and for people living with sickle cell disease. Our goal today is to inform you about ongoing sickle cell initiatives at the federal level and to prepare you to meet with your members of Congress. Today, we have an exciting lineup of topics. We open this morning with our keynote speaker, Andy Lord, and after our keynote, there will be a panel discussion on policy efforts to establish comprehensive care for sickle cell. After the panel discussion, attendees will have a 20-minute break. We will then all return to prepare for our Hill Day meetings. During this time, you will learn the National Sickle Cell Disease Priorities for 2023. You'll practice just how to meet a legislator and speak with them, and be put into breakout rooms so you can meet with your fellow advocates. When the breakout session has concluded, we encourage all of you to return to the main room, where we will wrap up with an inspiring video from the next generation of sickle cell disease warriors, followed by closing remarks. I will now pass the mic over to my colleague, Ashley Valentine.
Thank you, Regina. Hi, everyone. My name is Ashley Valentine, and I'm a co-founder and the president of Sickle Cells. Our other co-founder is the late and great Marcus Valentine, my dear brother. Thank you all for joining us to educate our elected officials and request more robust funding for federal programs to address sickle cell disease. I want to take a moment and thank you all for joining us virtually. Due to lingering COVID-19 public health concerns and the evolving rule changes in Congress, we decided to keep this year's event virtual to ensure the safety of our community, but we look forward to seeing you in person in the future. So tomorrow is a really important day for the sickle cell disease space. If anyone has been tracking politics as closely as those of us in DC, you'll know that the Hill is a little bit dizzying. We see headlines of this side not wanting to work with that side, but we all know that sickle cell disease is a nonpartisan issue. It takes both Republicans and Democrats and everyone in between working together to solve this thing called high quality healthcare for people and families living with sickle cell disease. And this is where you come in. Your voices and your stories matter. The people living with sickle cell disease every day will be the glue that encourages bipartisan collaboration and builds empathy with our legislators to ensure that sickle cell becomes a priority, and there are many priorities that they are balancing each day. So now I'll turn it over to my colleague, Dr. Lakia Bailey.
Thank you, Ashley. Good afternoon. I'm Dr. Lakia Bailey, Executive Director of the Sickle Cell Community Consortium. I am delighted that you all have joined us today. By working together as a community, we will share the most pressing need of the sickle cell community with our community leaders. We are proud to announce that we have 195 advocates signed up and 162 meetings scheduled on Capitol Hill tomorrow. Thank you all for your dedication. It is now my pleasure to introduce our keynote speaker for today's event, Mr. Andy Lloyd. And Andy began his lobbying career as the Director of Government Relations for the American Cancer Society in 2001. In 2006, he formed his own lobbying firm, Georgia Capital Solutions, to work exclusively with nonprofit organizations in Georgia. His firm represents 12 nonprofit organizations in Georgia. Andy and his children all have sickle cell trait, which led him to volunteer for the Sickle Cell Foundation of Georgia before officially becoming their lobbyist in 2017. To date, the foundation has secured nearly $2 million per year in state appropriations for the foundation. in addition to other noteworthy successes. Please join me in welcoming him as our keynote speaker.
Having the tech issues that disallowed me from being on this morning with you all visually, and thank you for that kind introduction. Again, my name is Andy Lord. I work with the Sickle Cell Foundation of Georgia here in Atlanta, and just want to give you all a quick overview about my background, what advocacy looks like here, how we intersect between state policy and federal policy, really. So quickly about me, I am born and raised here in Georgia, and at the time that I was born, we did not have sickle cell testing for every live birth in Georgia. By the time my son was born, however, we did, and my son tested positive for sickle cell trait. This was unusual to the physicians at the time, as my wife and I are white, my son obviously white. Our medical community here was very surprised by this, and in fact, they told us that when my son first tested positive, that they assumed it was a mistake. That's how much misunderstanding there was, even in the medical community here in Georgia. So they told us they didn't even tell us because they thought it was a mistake, and they retested my son's sample again, and it came back positive again. It was at that time that they did notify myself and the family. My wife and I both went and got tested, and it was me who had the trait. So I was well into adulthood before I even understood that I had the trait. I then spent some time going back with my family, just trying to understand the history. They were very unhelpful Southern family. And so I then started volunteering for the Sickle Cell Foundation of Georgia. And that volunteer work, to make a very long story short, kind of led to me. I was already a lobbyist here in Georgia. And that led to me officially representing the Sickle Cell Foundation of Georgia here at the state capitol where I am now. So one of the first things that I did after I began working for the foundation was to say, in Georgia, like in many states, there's a familiar refrain, which is that the budget is a moral document. You'll hear that term a lot around capitals around the country. And so I looked in the budget to determine what kind of appropriations we had for sickle cell. And I'm trying to remember, this was in 2017, I'm trying to remember what that number was. Oh yeah, $0. There was nothing whatsoever in the state budget. And this was, to me, the first tragedy that we had to remedy. And so we went to work in 2017, and we stated a goal that we wanted at least $1 million of state dollars appropriated within 3 years. And again, this was 2017. And we began that year by engaging the Legislative Black Caucus in Georgia. Georgia has the largest Legislative Black Caucus in the country. We engaged them. We engaged the Appropriations Committee. We engaged the Health and Human Services Committees. We engaged the Insurance Committees. And to make a very long story short, as we stand here today, we have nearly $2 million of state appropriations that is directed to the foundation itself. In addition to that, there have been sickle cell investments made in Georgia with universities to advance research and build out programs in those areas of the state. So we've had a lot of success in securing appropriations. But as we know, appropriations in and of themselves, does very little. So what do we do with those appropriations? We do a number of things. One of the things that we've done in Georgia is we have established, with that funding, we've established 7 brick and mortar sites across Georgia, in Georgia's largest population centers and those population centers that have the highest incidence of a sickle cell population. We have established clinics there that patients can go to. For any of you all that are in states that have large rural areas like Georgia, the access to sickle cell care in rural areas is unacceptably low. So we said, hey, we're going to go into the population centers and make sure that there is quick access to good care. The second thing we did is, because we have so many rural areas of Georgia that may not be able to sustain a brick and mortar center, we established what we call a mobile testing unit, or a mobile lab, which is a giant RV that we outfitted. We put a hematologist on that RV. We have equipped the RV with all of the training, education, telemed types of services that are needed. And we take that mobile unit into the most rural areas of Georgia to serve that community. So we have the brick and mortar centers to serve the high density areas. We have the mobile unit that we send out kind of into the hinterlands to make sure that that care is accessible for sickle cell patients there. Another thing we've done with the funding is we have invested in physician and mid-level training. We need physicians to understand, kind of like what happened with me. We need them to understand sickle. We need them to understand what resources are currently available in their area and in Georgia. So we go across the state doing trainings for providers so that we are sure that they have the latest and greatest. We partner with FQHCs across the state, other community-based organizations for events, educational events, to get the word out, etc. And we have also built out and improved, expanded our office with some of these appropriations, so that we can better handle the influx of patients that we see in Atlanta. So that's how we kind of direct some of these appropriations. One of the things we're also working on now is, we noted via a study committee for sickle cell that we had formed year before last. We went into the Medicaid budget here in Georgia, and we realized that the Medicaid reimbursement rates for hematologists to see a cancer patient are much higher than they are for the same hematologist to see a sickle cell patient. We are working as we speak to reconcile that as well. We believe that 30 minutes or an hour of a hematologist's time should be reimbursed at the same amount without regard to the disease state. This is why we see a shortage of hematologists in Georgia that are willing to see sickle cell patients, and we are working to remedy that. We have also passed a specialty license plate in Georgia, a sickle cell automotive license plate, and every one of those license plates that is sold, the foundation receives $25 of that increased fee for kind of the vanity plate or the specialty plate. We also got sickle cell listed in the acceptable medical conditions in Georgia for medicinal marijuana. So these are the examples of the types of things that the foundation has been able to do in a relative sense in a short amount of time. We went from having none of those things, no money in the budget, no license plate, no recognition in the rare disease parts of the budget, not initially included in the medicinal marijuana profile. And we were able to get all of those things done. We've been able to do that through partnerships. We take our mobile unit across the state. We try to engage the legislators of every district we are going to invite them to participate and see firsthand what we're doing day in, day out. We believe that this raises the awareness, gives us an opportunity to do education, not only with lawmakers, but with community members, and also with sickle cell patients or families that are struggling with the trait, with the anemia itself, etc. So we've had an opportunity to do that in Georgia. We have seized that opportunity. We continue year in, year out to increase our appropriations so that we can establish more satellite centers get an additional mobile testing unit so that we have 2 that are crisscrossing the state, equalizing these Medicaid codes, and making sure that the sickle cell population and their families are treated fairly and equitably, particularly with regard to incidents. We want our appropriations to at least be on par with other disease states with a similar incidence. So we have been successful. We've been successful in doing that, and we continue to try to expand on all of those areas I just enumerated. So kind of an overview of what we're doing in Georgia, and I'll pause there. Are there any thoughts or questions about any of these items, or suggestions about successes in other states that we can also implement here in Georgia?
Great. Thank you so much, Andy, for sharing that expertise. Let me just check the comments and questions section to see if anything pops up. Great. Andy, we're talking today about partnerships as well. So, again, this is our first national event that has pulled together such great partnerships across the country. Can you talk a little bit in your experience of how important these partnerships are and within your state and within your work?
Yeah, absolutely. It's a great question. Partnerships are, of course, always key, and that's intuitive to everybody. In the realm of kind of governmental policy or the advocacy at the respective state or the national capital, these partnerships become more key, because what we have found is for every organization that we partner with, wherever that may be in Georgia, every time we establish a brick and mortar center, let's say in Macon, Georgia, which is about an hour and a half south of Atlanta, when we establish a brick and mortar center, when we take our mobile unit there, when we start doing physician trainings at these places, again, we make certain to invite the legislators from that district, from that area. So in this case, in this example, from the entire Macon delegation. So we can have as many as 10 or 12 reps and senators attend an event at a place that we are partnering with somebody. Again, in this example with Macon, it might be with an FQHC. It might be adjunct with a hospital. When we invite them, they see us in their backyard. When we come back for the next legislative session, it's a much easier sell then for us to now go to those legislators that attended an event like that and say, hey, you remember we were in Macon in your backyard. Here's what we did. Here's how we're investing in your community. Would you help us in the appropriations process to secure additional dollars so we can do this in more areas? And they are so much more inclined. So when you build these relationships with your community, with every city and municipality and county that we venture into to establish one of these partnerships, we make sure to leverage those community partners to request support for our legislative agenda with their legislators the following session. So not only is the partnership important at the community level, because the foundation is a statewide organization, we want to respect what's going on in the local places around the state. So by having these partnerships, we're better able to understand the specific community needs and build a plan around those, but we also are able to leverage those community members to support our statewide agenda and appropriation. So it's really a win-win. Partnerships are key. Partnerships are an accelerator for all of the advances we've made in Georgia that I briefly touched on. And those partnerships continue to grow. And the more we grow them, the more bulletproof we become, not only in the state appropriations budget, but also in expanding our scope and our footprint in the individual communities themselves. So I think that the community partnerships are just key on multiple levels.
Andy, thank you so much for your time. Thank you for sharing your expertise. You've done a tremendous job in your state in making these partnerships. We look forward to really using your successful model in other states as well, and begin bringing care across the country. So thank you so much for being here today and inspiring our advocates across the country.
Well, thank you all. And apologies again for the tech difficulties, but very happy to join you all this morning and wish everybody great success in pursuing your sickle cell agendas going forward.
Thank you so much. Now we'll be moving into our panel discussion, beginning with an educational presentation.
Today's panel discussion will focus on policy efforts to promote comprehensive care for sickle cell disease. Our 1-hour panel discussion will include 10 minutes to introduce the topic and define key terms, 10 minutes for our panelists to introduce each other, 30 minutes for a moderated discussion, and 10 minutes for Q&A. To better understand the components of a comprehensive care model, this session will address key questions that include what components of comprehensive care are needed to deliver quality care to individuals and families living with SCD, what are SCD care centers and how are the criteria determined, what actions are needed at local, state, and federal levels to overcome barriers to establishing SCD care centers, and what strategies are clinics and policymakers using to address provider shortages in SCD. Let's start with defining key terms. Today's materials for the panel are based on information provided by the National Alliance for Sickle Cell Centers and Dr. Julie Cantor. My name is Elodie Antala, and I'm the program manager with Sickle Cells. We need to first understand what comprehensive care for SCD is. Comprehensive care is an approach that cares for the whole patient and all their needs. Many professionals work together to co-manage a patient and ensures that essential and support services for SCD patients are easily accessible. A comprehensive care team for sickle cell patients should include, but is not limited to, an educated nurse staff, patient navigators, sickle cell specialists, social workers, subspecialists, infusion specialists, mental health professionals, transition coordinators, and family planning specialists. Access to comprehensive quality care has been shown to improve outcomes and lower hospitalization and emergency room encounters. We also need to understand what a sickle cell specialist is. The National Heart, Lung, and Blood Institute's SCD Implementation Consortium has defined sickle cell specialists with 9 criteria related to training and experience. These include a specialist is knowledgeable of the evidence-based guidelines for SCD. The specialist is trained in hydroxyurea management and transfusions, is trained on screening for organ damage, is aware of psychosocial and cognitive issues, has experience working with sickle cell patients, is trained in pain management and on SCD emergencies, continues to attend SCD conferences regularly, is mentored by another sickle cell specialist, and continues medical education in SCD every 2 years. Along those lines, an SCD care center provides comprehensive, high-quality care for individuals living with sickle cell disease. SCD centers must meet certain requirements in staffing and services. Specialized care centers are sometimes referred to as centers of excellence. However, currently, there is no established criteria to be called a centers of excellence. The National Alliance for Sickle Cell Centers supports sickle cell disease centers by setting standards of care, promoting guideline adoption, identifying opportunities and resources to strengthen sickle cell disease centers, and advocating for access to comprehensive care to improve health outcomes, quality of life, and survival. One of the benefits of a care center model is to improve and standardize patient care and promote the adoption of treatment guidelines that reflect the newest evidence. The American Society of Hematology and other national organizations work together to set guidelines and standards to define quality of care for SCD. With these guidelines, accredited centers can then provide a standard of care for SCD patients. Comprehensive specialty care networks exist. Chronic genetic diseases such as cystic fibrosis and hemophilia have networks of comprehensive specialty care. Over 130 Cystic Fibrosis Foundation accredited care centers offer comprehensive, high-quality specialized care for cystic fibrosis. And approximately 141 federally funded hemophilia treatment centers specialize in treating people with hemophilia across the country. And although the population with SCD in the United States is over double that of hemophilia and triple that of cystic fibrosis, there is no equivalent system of care for SCD. Along those lines, there are various barriers to establishing SCD care centers. Those barriers include the underinvestment in federal funding and lack of attention, which has created challenges in establishing a network of SCD care centers. Additionally, SCD specialists and providers specializing in non-malignant hematology for adults are rare. And while most U.S. urban areas have SCD pediatric comprehensive care centers, those centers for adults living with sickle cell disease are limited. And upon transitioning out of pediatric care, adults encounter a lack of provider knowledge and a fragmented healthcare system. These materials can all be found in our program book. Our teams have come together to create a comprehensive care toolkit for your review. You can access your program book either physically, you have received it by mail, or on this event platform. Now that we have introduced the topic and defined key terms, this concludes the education section of this discussion.
Hi there, my name is Christina Hartman, and I lead Government Relations and Alliance Development for Bluebird Bio. Most recently, I served as the head of U.S. Government Relations for the Alliance for Regenerative Medicine. I started my career at the U.S. Department of Health and Human Services and have been a registered lobbyist in Washington in a variety of roles over the past decade. I'm also a rare mom, so I have a child with an ultra-rare neurodevelopmental disorder who is in complex care, so very familiar with the challenges that the community is facing. Bluebird Bio has 2 of the 5 currently approved gene therapies on the market here in the United States. We have Zynteglo for beta thalassemia and Skysona for cerebral adrenoleukodystrophy. Our gene therapy for sickle cell disease is currently in development, and we are preparing to submit our BLA, or biological licensing application, to the FDA. I'm also excited to introduce Dr. Andrew Campbell, who is the director of a large sickle cell disease program at Children's National Hospital here in Washington, D.C. This program follows over 1,500 sickle cell disease warriors from the DC, Maryland, and Virginia, or DMV region here locally. He also leads a large team of sickle cell healthcare providers. Also on the panel joining us is Dr. Fisipe from Texas, and she is a pediatric hematologist and sickle cell warrior and advocate, living with sickle cell herself. She is the co-director of the sickle cell program and considers her program very comprehensive. She's also very engaged in Texas state-level health policy initiatives and serves on various state committees, including the Texas Sickle Cell Task Force. Also joining us is Georgine Glass, who is the mother of a child with sickle cell disease and the founder and executive director of Dreamsicle Kids Foundation in Nevada. The Dreamsicle Kids Foundation is working to increase sickle cell disease awareness in the state and provide direct support to patients and families impacted by sickle cell disease. They also advocate legislatively for long-term change in the sickle cell disease community. And finally, also joining us is Stephanie Kaplan, the Deputy Director of Government Relations and Public Health at the American Society of Hematology, or ASH. ASH leads a multifaceted, patient-centric sickle cell disease initiative focused on access to high-quality care, research, policy, and global issues. So this panel here today is going to focus on a comprehensive care model for sickle cell disease. And thank you, Elodie, for really laying the groundwork with that excellent presentation. This session will now discuss what are the components of comprehensive care that we need to deliver quality care to individuals and families living with sickle cell disease. What are these sickle cell disease care centers and how are the criteria determined? What are the current barriers to establishing sickle cell disease care centers, and what actions are needed at the local, state, and federal levels to overcome these barriers? And finally, what are the strategies that clinics and policymakers are using to address provider shortages in sickle cell disease? And ASH has an excellent report that looks at the longitudinal workforce of current hematologists and predictions for the future. And they found that out of 2,500 practicing hematologists surveyed in the United States, 46% reported a shortage of classical hematologists focusing on non-malignant diseases and disorders, and 31% reported a shortage of hematologists who specialize in blood cancers. So these topics are very timely, very relevant. And the first thing I would like to do is give each of the panelists a moment to really introduce themselves and tell us a little bit more about their work. So Dr. Campbell, if it's all right, I'd like to start with you.
Yes, hello, hi. I'd like to thank the organizations inviting me to be on this very important panel for the National Sickle Cell Policy Forum. I'm currently director of the Comprehensive Sickle Cell Program at Children's National Hospital and care for over 1,500 sickle cell disease warriors from the DMV region. We lead a very large team. We have 6 hematologists, 5 nurse practitioners, 2 coordinators, 2 social workers, 2 psychologists. We have a very large transition team. And I have been also an advocate in terms of legislatively and improving the access of care for sickle cell disease patients, not only locally, but also nationally. And I've been involved in multiple efforts to bring this to the national attention to this important issue in terms of access and treatments for sickle cell disease patients. So I'm very honored to be here. Thank you.
Thank you, Dr. Kaplan. And next, Dr. Fisipe, if you would like to introduce yourself.
Thank you. I echo Dr. Campbell's words. I appreciate being here today, and thank you for the honor of allowing me to participate on this panel. I'm a pediatric hematologist, and I'm a sickle cell warrior and advocate. I work at Texas Children's Hospital, and there I serve as the co-director of our sickle cell and thalassemia program. I consider us mostly comprehensive. You know, when I look, we're going to talk about this later, but I do feel like there's room for every sickle cell clinic out there to grow and improve, which is why I'm glad this conversation is happening today. And it led me and kind of inspired my advocacy journey. So I look forward to sharing more.
Thank you. And next, Ms. Glass.
Hi, everybody. Thank you guys for having me. So I am Georgine Glass. I go by Gina to make it easier for everybody, but I am the mother of a 8-year-old with sickle cell disease, which led me on this journey of advocacy and supporting sickle cell patients and their families. Especially being a caregiver, I wanted there to be focus on caregivers because they're very important in supporting sickle cell patients. I've been here in Nevada about 7 years, and due to my personal experience with sickle cell and the treatment for my daughter, we established Dream Sickle Kids Foundation to increase awareness of sickle cell disease here in the state. So we've been doing that for the past 5 years. Our organization will be 5 next month. But early on, I recognized the importance of working together and collaborating with healthcare providers and other advocates in the sickle cell community. Our community here is a bit small compared to others. However, our community is still just as important and deserves to have adequate resources and such as any other sickle cell community. So through Dream Sickle, we provide direct support to the patients and families. There's not a lot of red tape, I would say, to get support from us. I know that there are oftentimes with other larger agencies and organizations, there's a lot of red tape and qualifiers. So I on and when I lost my job so often, I missed a lot of work and I couldn't qualify for because of the fact when you look in my income employment record, you can see the amount of money I made. So according to a lot of the federal state agencies, I didn't qualify, even though I was unemployed and virtually had no income. Just because of my past history, I didn't qualify. So we do not have those qualifiers. If you're a sickle cell patient and you're in need, and we're able to establish and justify that need, then we are going to help you. It doesn't matter if you still work a 9-to-5, making 60, 70,000. We know with the pandemic, there were a lot of people who made great money and things like that and just fell on hard times. Things happen. So we want to make sure that we support everybody in the sickle cell community that may have a need. Through our collaborations with the healthcare providers and my connections with legislators, which I kind of fell into, we were able to make a lot of changes here in Nevada for the sickle cell community with establishing or getting a sickle cell bill passed here in our state to establish a sickle cell data registry, to expand the Medicare coverage to cover any new medication that comes to market specifically for sickle cell for patients that are Medicaid beneficiaries. And we also opened our first comprehensive sickle cell clinic to treat adults and children here in Nevada. Prior to that, there was no sickle cell specific clinic. Most of the adult patients are seen at comprehensive cancer centers. And there's a complex pediatric clinic here that treats about 300 of our pediatric sickle cell patients. However, now since 2020, they actually have their own home where they have qualified medical providers who have specific knowledge in sickle cell disease to treat them. And also because of our collaboration, we were able to collaborate with that clinic and write a proposal and receive the HRSA grant in 2021. So now we have the HRSA grant to expand the support that we can provide to sickle cell patients here to ensure that they have a medical home, to offer additional education to current and future medical providers that may come in contact with sickle cell patients and have the need to treat them. And we also are increasing our network of community health workers. So we're making sure that we essentially have a community health worker for all 1,000 of our sickle cell patients that we have here in Nevada.
Well, Gina, that is incredible. Thank you so much for that. I wish we had your efforts in every state here in the United States. And I'd like to turn now to Stephanie and just give her a moment to introduce herself as well.
Thanks, Christina, and thanks to all the meeting organizers for the opportunity to represent ASH on this panel. We're so grateful to be with all of you. We work closely with both Drs. Campbell and Fisipe as ASH members in helping to lead ASH's multifaceted sickle cell initiative. As Christina mentioned, ASH has embarked on a multi-year, multifaceted initiative to really drive change in sickle cell disease. This focuses on efforts on the policy front, on the global front, efforts to advance research and training and education. We do this collaboratively with the community as well as with many other stakeholders. About 6+ years ago, ASH founded the Sickle Cell Disease Coalition, which we remain the managers of. And we really think that this is a collective effort. So we're grateful for everybody's commitment to really driving change in sickle cell. I oversee all of ASH's advocacy related to sickle cell, along with my colleagues on the government relations team at ASH. We work closely both with Congress and government agencies to help improve all government-funded sickle cell programs and to really raise awareness and make change for the disease. So looking forward to the panel today. Thank you.
Fantastic. Thank you. And I'd like to start out with a question about the comprehensive care. I know how challenging it can be, especially for clinicians. We have our own set of complex care and specialty physicians, and the amount of time and dedication that they have to the patients is truly incredible. But what are some of the other elements of comprehensive care that we really need to deliver quality care for individuals and families living with sickle cell disease? What types of expertise and roles do we need to see on these comprehensive care teams? And I'd like to start with Dr. Campbell and Dr. Fisipe. Based on your experience as clinicians, what are you seeing as those additional needs?
You want to start?
Sure, that'd be great.
Yeah. So first, I want to say it takes a village of compassionate, multidisciplinary providers to provide that wraparound care, but not only for the patient and family at the hospital, but also care at home. So traditionally, as discussed in the introduction, and we need physicians, advanced practice practitioners, social workers, nurse coordinators, nurse navigators, case managers, psychologists, mental health providers. And also, when I talk, we don't talk a lot about case managers, nurse navigators. We really need to improve the access to care that our patients need. So as a healthcare provider, I can write all the prescriptions and tell our patients what to do. But if they cannot get here to the clinic, they don't have access. If they cannot have a medication because of prior authorization, they will not get that. I also like to highlight the payer clearance team as well at your hospital, getting them involved, and also P&T committees of Medicaid, for example. So getting team members in your program to communicate to different stakeholders in increasing the access to care for your patients. The other points are other important are individuals or and providers or mental health providers. I think there's a lack of those, and advocating for mental health providers as sickle cell warriors go through this journey. I think they're very, very important. Also, access to specialists. I think it may not be at your hospitals, like pulmonologists, orthopedic surgeons, ophthalmologists, physical therapists. I think they're also very, very important. And then I guess lastly is access to community-based organizations. There's so many in sickle cell disease, and they can improve that access to care for your patients. So kind of overall, I think the traditional sense, the healthcare providers, but also having members of your team improve the access of disease-modifying therapies and access to transportation, and mental health providers, and then subspecialists. I think those are additional important components of a comprehensive care team as the introduction, as discussed in the introduction of this session. Thank you.
And Dr. Fasipe?
Yeah, that was so wonderful, Dr. Campbell. This is why I consider Dr. Campbell one of my mentors in this space. It's something I've been learning to try to figure out. What is the definition of comprehensive care? And how do we identify what are the bare minimum, this must be there, and what are things that can even take it a step further? So one of the first things I'll say is that sickle cell is a chronic disease. And it's almost like it's crazy that we have to remind people or say that, but it's not being treated like a chronic disease in this current time period in our country. And so a chronic disease requires a lifespan concept of care. So that means it's the medical aspects as well as the quality of life aspects. And so recently, 2 articles have done a great job to look at that on the adult side and the pediatric side. What is our wish list? What's the hashtag goals attempt for a comprehensive care center? And I was so happy to see the diagram that Elodie showed. And it sounds as if you have that resource in front of you where it shows those wish lists. Like, this is what we consider comprehensive care for sickle cell. So I'm still trying to advocate for those things at my own center sometimes. We all call ourselves comprehensive centers, but if you investigate, we don't have everything on the wish list. So there some essentials that Dr. Campbell emphasized, like you want to have somebody with expertise with sickle cell. You want to have a care coordinator of some kind or a navigator. You want to have a social worker. But then you also want to consider those other elements like the mental health staff and even having an infusion room or a day hospital. Those are essential components that would be on that wish list. And then understanding the link between primary care and your specialty care. So sickle cell is not the only thing that you have to think about when it comes to health. So I will stop there, but I think we really need to think of this wish list is like, it's sad that we're putting it as a wish or a dream. It needs to become reality for more individuals, for all individuals with sickle cell disease.
Absolutely. Thank you. And Gina, any thoughts from your experience as a recipient of care? I mean, anything you'd like to add?
They actually summed it up pretty well. I will just say, like as a parent and as a community-based organization and a community health worker, I think the social services are very important, and also having that relationship with community-based organizations and having community health workers. Just in my experience, doing community health work at our clinic, there's a lot of things that from the provider side, they may get frustrated because they're like, why is this patient not taking their medication? Why are they missing their appointments? And they may think it's just that person is being difficult, but as a community health worker, we have conversations with those patients where they're telling us like, look, my home life is crazy. I barely have a place to sleep. I can barely make it to work. My car broke and I can't get from point A to point B. I work remotely and I can't stop working to come to, a doctor's appointment, even though I know it's important. Sometimes maybe they might have a copay on their prescription that they can't afford. I literally just, I was at a brunch the other day and it's my off day and I'm getting phone calls because a sickle cell patient, she couldn't get to the pharmacy. It closed at 5 and I got her to the pharmacy, but then there was a copay. It was nominal, but she just didn't have it at that time. So instead of enjoying my brunch, I'm on the phone trying to make sure I can get her from point A to point B. A physician isn't able or doesn't have the capacity to be trying to do things like that on duty or off duty, sending Ubers to people and things like that, or, like we'll Cash App or Zelle them the money because sometimes we can't always follow the traditional, let's keep a strict record of things. Like sometimes they need it right then and there. So community health workers can do that, and community health workers can get information that would help with insight into the provider side as to why a patient is doing or is not doing the things that they do. So I think that that's a really important part of comprehensive care as well.
Yeah, absolutely. Like Dr. Campbell said, it does take a village. That's for sure. I'm glad you're doing that work. And again, I hope we can extend it across the United States. And Stephanie, I wanted to turn to you as someone who's really focused here in Washington. What are your thoughts on what can be done? You know, what are some of the immediate next things we should be focused on, current opportunities related to this need for comprehensive and wraparound care? Any thoughts on the legislative perspective?
Sure. So I guess just to add on to what others have said about comprehensive care, just one other piece of the puzzle that I think has been mentioned, but I just want to underscore is ASH has really been looking at ways to not only make sure that that care is out there, but that it's also high quality. So some of the additional pieces of the puzzle is making sure that we have care guidelines, which ASH has released, but not only just having the guidelines, making sure they're implemented, making sure we're working with colleagues across medicine to ensure that they're aware and have the tools that they need to really implement high quality care as well. And then also quality metrics, ways to measure this care and make sure that it's really being rolled out in an effective way. And we've been advocating for quite some time for quality metrics that are in existence and also developing new metrics. So before I moved on to the legislative side, just wanted to mention that. But on the legislative side, we've been working for a very long time with partners in the sickle cell community and also partners within the federal government and with congressional champions in sickle cell disease to really look at comprehensive care and how we can change policies to test different models that may help improve that care. One bill that was introduced at the end of 2021, and we're actually hopeful that it will be reintroduced later today, both in the House and Senate, is the Sickle Cell Disease Comprehensive Care Act. And the focus of this bill is really to authorize the Centers for Medicare and Medicaid Services to conduct a 5-year demonstration project in up to 10 states to improve access to high-quality outpatient care for individuals with sickle cell disease that are enrolled in Medicaid. There's a focus on young adults and pregnant women with this legislation and with this demo. And I think the rationale for why this demo is needed has already been outlined today to really improve access to care in the outpatient setting, to avoid complications, to help improve quality of life, and to decrease costs to the healthcare system. So we worked with key congressional champions over the past couple of years to establish this demo. And really the key elements to the demo include a multidisciplinary care team, just as the importance of that has been mentioned already, looking at best practices for improving health equity across the board, ensuring access to primary and preventative services, including reimbursement for care coordinators, community health workers, and other non-traditional services. Also developing individualized, comprehensive patient-centered care plans, and really ensuring that patients are provided with coordination and access to services and therapies needed to treat sickle cell, such as transfusions, MRIs, including pain management and treatment and symptoms management, supportive clinical services, including vision and dental, mental health services and substance use disorder treatment, and then referrals to community-based organizations and services from social workers. Again, these are the comprehensive elements, and we're really hopeful that the bill will be introduced later today. We're grateful for all the advocates who advocated for it in the last Congress, but we really think this bill will help show CMS just how important and effective comprehensive care can be.
Well, fingers crossed. That would be incredible.
Thank you.
And we're hearing in the chat that transportation is really a big issue. Are there any opportunities that you're aware of in terms of establishing federal policies that would include transportation reimbursement or supports?
Sure, I'm happy to take this. So the Comprehensive Care Act does include coverage for some of those services. And we absolutely agree that those are imperative to make sure people can even get to the providers.
And Gina, in addition to the prescriptions, is that something that you're seeing quite a bit of?
Yes, definitely. Transportation is definitely an issue. And then especially in the sense where So like Nevada is unique. We don't have a lot of places or hospitals that are sickle cell friendly. So we get calls from patients who are having pain or having issues, and they may have a hospital that's, 5-10 minutes away, but they know already that they won't get that service. So they want to go to a hospital that they know is more familiar with sickle cell. And as long as it's not an emergency situation where they need 911 and they should call, 911 for emergency transport, we will send them to the hospital of their preference, which is usually a hospital we already know is going to treat them better as a sickle cell patient, which is unfortunate, but I would rather pay $30 or $40 for them to get someplace where they're actually going to get the care that they need, as opposed to just go to the nearest hospital to be sent home within an hour or two in the same position.
That's a great point. And I just want to remind folks, please feel free to use the chat. We are looking at questions in the chat, and the team from Sickle Cells is sending them forward. So if there are questions that come up as the discussion is happening, please do enter them into the chat so we can try to make sure to present those to the panel. Dr. Fisipe, I want to turn to you for a minute and talk a little bit more about the work that you've done in Texas. Beyond serving as a clinician and living with sickle cell, you've also done a lot of work, particularly with the state of Texas. Are there actions that you've made in Texas that you think we really need to think about at the local, state, and federal levels nationwide? Any thoughts or comments there?
Yes, so many thoughts. So I once asked a speaker at a conference, and I asked, what is the most important thing the sickle cell community needs to move forward? Like, how do we get sickle cell? How do we solve this problem? And his response was advocacy. And I realized that advocacy leads to strategic health policy initiatives when done well. And so whether you're talking at the local level, state level, or national level, you need strategic or smart, effective health policy to get you to that goal. And advocacy is the key ingredient to that. So advocates need to speak with a loud voice, but it needs to be one voice. And again, it doesn't matter whether you're talking about local, state, and national. So to give some examples of all three components in my experience, from the local standpoint, in Houston, all of our sickle cell community-based organizations had a meeting with the Houston Health Department one day, and we were like, we need to do better for Houstonians with sickle cell and their families. How do we achieve that? And the Houston Health Department, together with these CBOs and self-advocates, they formed the Houston Sickle Cell Collaborative. And we've been able to host summits and sessions, educational sessions, to try to figure out what is our internal problem here in Houston look like, and how can we do better and improve our community from within. It also helped us to organize in a way that when it did come to state policy, we can say, hey, the Houston group, we support this initiative, as well. So that's one component. From the state side, and I will say 2016 was almost like this winds of change year. I believe Stephanie alluded to this, and so did Elodie. In 2015, Ash actually called together a big summit of everybody, including the sickle cell community, and is like, look, we need to be real about this issue and give ourselves a grade. We're doing poorly. We suck. Bottom line. That was the discussion points at the meeting. And so now it's like, how do we move forward? Now that we know care is terrible for sickle cell, what are the elements that we need? So that led to several things. And for Texas, it just kind of aligned that we had a new legislation that asked for a sickle cell sickle cell advisory committee. That committee then spurned new legislation for a sickle cell task force. And I've been privileged to serve on both. And now we don't have to be in the room for people to talk about sickle cell. They'll be like, oh, what is the sickle cell task force? They're going to want to say something about this. And we have champions trying to go to bat for us at every level. So on the state side, figuring out how to get your state, if your state doesn't already have one, some version of a sickle cell. I've heard different words used. Louisiana has a commission. Different states call it different things, but you need people that are going to be the bell ringers, like, hey, we need to do better for sickle cell, and we need to hold people accountable to that. Our initial beginnings were to focus on 3 parts: the Medicaid component, like how do we get better care for those that receive Medicaid in our state, and how do we empower payers to be accountable for that care. So that's one big arch. The other one is public awareness. We know no matter how many times you say the word sickle cell, somebody still says that they never heard about it. So we want to figure out, how do we make sure sickle cell is a known word, a known condition in our state. So we have a whole subcommittee dedicated to that. And then our other one is dedicated to surveillance. So how do we count the individuals in our state, and how do we find the high need areas? Now, recently, right now, we're actually in a legislative cycle. There's 2 new bills for sickle cell, and they're going to focus on education. So whether that's the public health system to the medical system, we need to teach our doctors and primary care providers to do better. But then also there's a legislation focusing on health homes. And so, and registries and a whole bunch of stuff that I won't go into, but bottom line is we started somewhere, and then that kind of grew our confidence, and also grew the expectations that this should be a reality for sickle cell. So I'm going to end with talking about the national one. And I have to give 2 shout outs, or several shout outs, to Ash. I've told people who've heard my story have found that I was an accidental advocate or a hesitant advocate. I was very scared to discuss my disease because I saw the stigma associated with it. And it wasn't until I met people from community-based organizations who were bravely sharing their stories that I became inspired. And I try to figure out, how do I be a doctor and an advocate together? And Ash helped me with that. They have something called an Advocacy Leadership Institute. And they taught me how a bill becomes a law. They taught me all the stuff I used to see as a little kid. They taught me the power of that smart health policy when it comes to national legislation, and how it can improve lives and outcomes. The other thing that I'm privileged to be a part of is their quality technical expert panel. Very fancy sounding, but we want to hold hospitals accountable for how they interact with individuals from sickle cell. So this expert panel meets to figure out, what are the things that we can say, hey, what are quality measures that we can say, are you up to par? Are you actually meeting this goal for sickle cell? Yes or no? And this is what it looks like to meet that goal. So I'm going to stop there, just because I could talk about all of this forever. I'm just so grateful that these winds of change are happening, and I'm able to get a front row seat and get my hands in on the work too. So thank you.
Yeah, I think you're right, Dr. Fasipe. This is definitely the time for sickle cell, and we are hearing quite a bit in Washington about it. And I think that's great because, as you know, it can be really tough to cut through given all the different priorities and all the different groups that are competing for attention. So I love what you said about really coming together, talking with one voice as a community, and trying to really develop champions here in Washington for the sickle cell disease community. I think that's really, really important. And also holding legislators and others accountable. Because remember, I know you all have the fly-in tomorrow, and those folks work for you. They're your elected officials, and they're there to represent you. So I'm glad you all are getting together and talking to them and advocating tomorrow for the community. I now want to turn back to Dr. Campbell for a minute. One of the things that came up in the chat was the use of telehealth. That's something that was a very popular option during COVID. How can telehealth help with some of the challenges in terms of access to clinicians? How does that impact the sickle cell disease community?
Yeah, it's actually made a great impact during the COVID pandemic. I think a lot of healthcare providers did not know how effective it could be. And I can tell you personally, living in a tri-state area, Maryland and Virginia, actually relaxed their laws, allowing us to communicate with our warriors and providing sickle cell directed care. And it really changed the percentage of visits that we had. We rarely had telehealth visits. But now what we do is we actually incorporate telehealth visits as an option for our patients. And for example, in our transition program led by Dr. Barbara Speller-Brown, we now can do telehealth transition visits, which makes a significant difference. After that initial in-person visits, we can do education. But also patients who live, for example, in our region, like on the Eastern Shore of Maryland, which is over 2 hours away, for example, we can communicate with the patients. So in between visits, maybe for every 3 visits in person, the other 2 can be telemedicine, and we can communicate also, if needed, with their healthcare providers by telehealth. Also, if they're hospitalized, we can communicate with them. But it has made a significant difference. So nationally, as part of this new initiative, I think these telehealth services now has to be brought to a higher level of attention, because as I think Gina talked about this, is that, we talk about these comprehensive care centers in these larger cities, but it's actually the smaller mid-level, smaller communities or mid-size sickle cell programs, or their patients, their cities who have lots of sickle cell patients but lack of sickle cell providers, or telehealth can play a significant role for those patients. So I think this is something that needs to be elevated on a national level and a legislative level. And I think actually eliminating barriers between states. So for example, in Maryland, DC, Virginia, you need to be licensed to continue telehealth services in each of the states. After the COVID pandemic, relaxations stopped, they went back to pre-COVID conditions. So we really need to tell our legislators to kind of relax those efforts so we can improve the care for our families and patients. Thank you.
Thank you, Dr. Campbell. That's a great point. And generally, in terms of all of these needs and trying to make sure that we're holding legislators and others accountable, making sure that we're making progress for the community. Stephanie, do you have any thoughts on what ASH is doing and some of the guidelines that are out there, and the ability for us to meet what's written into those guidelines and what else needs to be done?
Sure. So we're taking different approaches. As Dr. Fasipe mentioned, we're in the midst of developing new quality metrics that are based off of those guidelines. So that will be one way to measure. Another way that we have to measure is just metrics, looking at the downloads. Also, we currently have an open RFP for mixed methods research teams to conduct work that will help us understand the impact of the guidelines, which would ask questions about utilization and implementation of the recommendations. This is work that hasn't started. Again, there's an open RFP for it. And then in addition to that, we've really spent a lot of time working with colleagues in other areas of medicine, such as emergency medicine and hospitalists, to make sure they're aware of the guidelines and to develop tools that could be used at point of care. We've also spent time working with the CDC in developing tools that could be used based on the guidelines for the sickle cell disease community. And then finally, I just wanted to mention that the ASH Research Collaborative has kicked off a learning community focused on sickle cell disease. And this is currently in its pilot phase with a group of centers that are networking together to share data and to look at ways to improve quality of care and to assess that data and really share best practices for improving the translation of that care. So that will be expanded over time to additional sites. But again, lots of different efforts from a lot of different angles to measure the use of the guidelines and the quality of care.
Excellent. Thank you so much for that. And one of the other things that keeps coming up is, how do we better educate not just the general community about sickle cell, which we need to do, but also medical students, residents, those in hospitals. We don't want sickle cell patients to have to continue to worry about which hospital they're going to go to. I know that's the situation now, but what can we do to better educate the medical community. Gina, I want to turn to you for a minute to comment on that.
Thank you. So I wanted to touch on this because I've been doing a lot of education at University of Las Vegas here in Nevada, UNLV, just because of the relationship that I've developed with UNLV. I sit on one of their nonprofit boards that is housed under the School of Public Health. So I have a good in into the university. So with that, I just began, just with my knowledge and with what they know I know about sickle cell, they started inviting me to come to speak with their public health and medical students about sickle cell. So we kind of have a project, we call it our Nevada Sickle Cell Disease College Tour. We don't have an HBCU like other places, but we do have a patient population with sickle cell. UNLV has a medical school. Public health, sickle cell is also a public health issue. So those students need to know about sickle cell. So I've been going and having discussions with the public health and the medical students. We talked to the second year medical students who were about to start their residency, and we discussed sickle cell. And because of my collaboration, again, this is why I say collaboration and working together is very important. So my daughter's hematologist. She's the one who created the comprehensive sickle cell clinic here. I was able to get her to come with me to UNLV so that I would talk from, caregiver, community perspective. She would give, the clinical information that the medical students would need and want to hear. And then also another member, our community health worker chair at Dream Sickle Kids, her name is Naja. She's also an adult sickle cell patient. So she came to discuss the patient perspective of sickle cell. So they got to see 3 different perspectives of sickle cell and how it is not just on the medical side, but on the social, personal side. And they really were interested in that, and a lot of things they hadn't heard about before. And after they're sending messages that they will, remember that, and they'll think about that when they go into, the clinic, the hospital, and they come in contact with sickle cell patients. Later today, I actually am going to be talking with the UNLV public health students again, and we'll talk more about the health disparities that impact people with sickle cell disease. And also, it's a part of us trying to solicit for interns, because a lot of our community-based organizations are not very large and don't have huge staff, but students have to do internships. So like the public health students, they like to do internships with like organizations, nonprofits. So we've gotten a couple of good interns from these talks that I do and attending their internship health fairs. And from that, I just got another invitation to go to another university, a nursing university, and we'll be talking to the nursing students about sickle cell disease. And then a random was, my daughter is 7, so she's in school, and we tried to do regular school at the beginning of this year. So she went for about 2 months to regular school, but she got sick one too many times for me. So she's back on homeschool. But in just talking to the staff there, letting them know, hey, my daughter has sickle cell. I want to talk to the teacher that she'll have so she'll know about it. I have information about sickle cell that I want to give to the nursing staff. And just from that conversation, the director of, I forget what the actual title is, but she basically manages all of the school district's nurses from K through 12. And she invited me to come out and do a workshop with about 200 of the Clark County School District nurses. So nurses K through 12. I was able to go out there and talk to them and actually get them CME credits because a medical provider was actually there and a part of that workshop, and they learned about sickle cell disease and how to better support their students with sickle cell, what they might see when they have students with sickle cell, why they might have to go to the bathroom more and things like that. So it's just about building relationships and collaborating and just talking about sickle cell. When I went to my daughter's school, I was, concerned about making sure that the school treated her right as a student individually. I wasn't thinking about going to talk to hundreds of, medical nurses about sickle cell, but because of that conversation, it turned into me being able to provide some education to, those nurses who are going to see students from the beginning to the end that might have sickle cell disease.
That's incredible. And Dr. Campbell, did you want to also add on to that?
Yeah, I'll be brief. I just want to say that I think we need to also challenge our medical schools, as Gina, did a beautiful job explaining why. But really, as providers, talk to medical schools, nursing schools, anyone who is a healthcare provider, to include sickle cell in their education, and also rotations. There are hospital residencies that does not require hematology oncology rotation as their core rotation. And if they do it, sickle cell commonly may not be part of that. So the ACGME, which is kind of the organizing board of graduate medical education for medical student trainees, resident trainees, very, very important to kind of advocate that at your local hospitals.
Excellent. Thank you so much. And I know we're coming up on the end of the session, so I want to give each of you 30 seconds to really let us know, what are some of the essential next steps in establishing this national network of sickle cell disease centers that would allow us to provide comprehensive and community-based care for all sickle cell disease warriors. And Dr. Fisipe, I'm hoping to start with you because I know we also wanted to do a quick bit on transitions from childhood to adults. And so maybe if you can also add in a quick note about that in the closing remarks.
I will try. I will say that it is devastating and inexcusable that young adults are dying with sickle cell disease. It's just ridiculous. And so this transition population is very important. Elodie did a wonderful job describing why adults in particular have challenges with the healthcare system. So I'm not going to repeat those things. I'll just leave you with a quote I got from an article that talked about individuals with sickle cell are not drug seeking, they are care seeking. And the reason why they're care seeking is because there's no quality care to be found. They are looking for high quality care, right? And so how do we alleviate these barriers? I already emphasized advocacy and smart health policy, but we need to hold people accountable to the guidelines. We need to invest in the pipeline of growing up compassionate physicians. We also need to talk about our insurance problem here. Children get insurance, adults don't always get the right opportunities for insurance, and that's ridiculous, especially if you have a chronic disease. And then, I don't want to go on too much. There's just so many ways. We mentioned telemedicine. There's also a concept of telementoring. So some of you may have heard of ECHO programs. So there's just so many ways we can do better. And I'm glad that we're all working together to do that. And let me defer the rest of the time to the other panelists.
Absolutely. And Stephanie, any thoughts from you?
Sure, thanks. I agree with everything that's been mentioned. I'll just underscore, I think that more education and training of hematologists and other providers is really important. Ash has done a lot on both the training and education side to make sure that people who aren't at centers, like Dr. Campbell mentioned, who don't have sickle cell focused programs, can visit another center that does. We've had centers to train people how to build adult care centers. So really the workforce issues are imperative. Also, again, we need to look at ways to improve payment and reimbursement for SCD care and treatment. And really, we think moving forward and advancing the Comprehensive Care Act is really key to that. And then finally, I'll just note that we still are learning a lot about where people live with sickle cell disease and how they're getting care. And so data collection is really important. And the CDC has a great program, which we're hoping will expand to more states. It's currently only in 11 states. So again, I think there's a lot to do, but I think we're on a great road, and we can definitely all advocate collaboratively to move the ball forward. Thank you.
Excellent. Dr. Campbell?
Yeah, I'll just add on what Stephanie and also Dr. Fisipe said. I'm just going to put a plug in for the Sickle Cell Treatment Centers Act of 2022, which is enables hospitals that offer sickle cell disease specialized care to partner with more accessible community health centers and outpatient centers to implement this hub and spoke framework of delivery of care and treatment of patients with sickle cell disease. This will authorize over $535 million of funding. 70% will go to hub and spoke model, 20% community-based organization, 10% towards the National Coordinating Center that would be proposed. So, and also the Sickle Cell Care Expansion Act 2022, which also would expand National Health Services Corps to attract providers to sickle cell disease and workforce and improve the care to access for these suffering with sickle cell disease. This is supported by multiple senators and legislators, Senator Van Hollen, Booker, Danny Davis, Barbara Lee. I mean, so many of our legislators who've been supportive. So I would say that we don't have enough from the federal level, legislative level, to actually enact a lot of the things that we just talked about in a comprehensive sickle cell act that Stephanie mentioned. We need all of these legislative initiatives to really improve the treatment and access. This has gone far too long. It's 2023. We need to act now. And I think I'm very enthusiastic about the momentum that's happening nationally on a national scale and everywhere here on this policy forum. But we really need people on the ground roots level to really help. I know that's why I'm very happy to be a part of this National Sickle Cell Policy Forum to really get the word out. And I commend the organizers for this. Thank you again.
Thank you, Dr. Campbell. And Gina, as somebody who's at that grassroots level, what do you have to say to the advocates as we close out this session?
I think that I think we're doing the best job that we can as advocates and community-based organizations. What I see is that, it's not as hard to establish these connections and partnerships to advance, sickle cell care on a smaller level, like with clinics or, even getting into the schools and universities and things like that. The issue that I see, I don't know, it could be just Nevada, most people here are, on board, they want to support. It's the large, hospital facilities that don't, jump on, that don't really put too much concern or interest or, turn anything towards, sickle cell support. So the big hospitals, we need to figure out how to make that connection so that they can support us. The clinic, everywhere there's, some places there's the small comprehensive clinics and things like that, but it's rare that it's one of these huge, hospital networks that are really supporting sickle cell. So I think that's definitely an area that needs some improvement.
Absolutely. Well, thank you so much to all of you for taking the time. And thank you to the SCD Policy Forum for having us all here today. I'm now going to return this over to the moderator.
Thank you so much for all of our panelists, for Christina for moderating such a wonderful discussion. Today, I'm happy to introduce Dr. Marjorie DeJoy Brewer, and she is the owner of MadFit, a medical consulting and wellness and health business, and currently holds the position of medical director of hemoglobinopathies and in global medical affairs and global strategist at Vertex Pharmaceuticals. She's also the medical director for the Sickle Cell Associates of Delaware, in addition to many other roles and many of her other roles across the community. Herself a patient of sickle cell disease, she is a practitioner of comprehensive and preventative health and wellness planning. Please join her for a guided break over the next 10 minutes, in which we will be followed by a free break. And we ask to meet back at our computers at 12:40 Eastern Time to resume this training. Thank you so much for being here with us.
Good day, everyone. Thank you so much, Emma, for that. Maggie, for that introduction. And it's so wonderful to be with all of you here today. I really want to take a moment to just honor and applaud the panelists that went before me, and for the advocates that are listening and individuals who will be participating today and in tomorrow's activities. they really crystallized so many amazing messages. Everything from Dr. Campbell's opening with "It takes a village" to Dr. Cece's comment about not being an advocate necessarily at the door, but becoming an advocate and training and how to become an advocate. Really taking the words into the collaborative that Stephanie shared with coordinated care, and then Georgina with the ground roots, that everyone's voice has such an important part in this picture. And that sometimes the message we give, we don't realize who it'll connect to and how much it will magnify the work that we're trying to get done, and that every one of our voices is so essential. And with that, I really want to focus the next couple of minutes on realizing and harnessing that voice and internalizing the thought that each and every one of our voices matters. And as we crystallize that message, we can then elevate the work that we need to do and that we're all championing for warriors across the world and across the globe. Because I think when one area succeeds, it then creates this effect that all areas succeed. So with that, if you're sitting in a chair, which I am today, please sit with your feet flat on the floor, preferably, and lifting in your chest just a little bit, feeling the grounding in the floor. That's the support, almost that we're standing on the shoulders of other warriors who have come before us, the warriors who are present today and the ones that we're fighting for the future. Feel the grounding in your seat, in your chair. Allow your heart to open to receive the inspiration that this panelist has given us and also that we have in our own lives. But as we soften our shoulders, releasing that jaw, and I invite you to maybe gently bring your eyes to the floor or bring your eyes to a close as you soften, and visualize the many warriors that we are advocating for, that we are uplifting through the time and the expertise and the platform that this forum is providing. As you take your next deep breath, allow your body to settle. Allow your mind to resonate with the message that connected with you the most. Allow yourself to even visualize yourself delivering that message to those individuals that we will be speaking to. Taking a moment to pause in our breath gives us an opportunity to appreciate the magnitude of the work that we are collectively doing. Inhaling the acceptance and the appreciation of the importance that you play in this landscape. And gently exhaling all the barriers. Inhaling your conviction to the process. And exhaling any determinants or deterrents. Inhaling your resistance, your resilience and commitment. And exhaling any resistance. Again, inhaling the inspiration and exhaling the obstacles. And as you sit and get grounded, for many advocates, recall the past conversations that you've had that has had an impact and moved the needle that has brought us to where we are today. each and every breath, we are able to further the cause for our warriors and the sickle cell community. With each and every breath, we are holding space and speaking for those warriors who cannot or who are unable to. With the next breath, inhale the strength that you possess in the work that you do. Inhale the knowing that every voice matters. On the next breath, inhale the knowing that together and collectively, our advocacy work will change the landscape for the better for every warrior. And with that, I'll invite you to gently open up your eyes. Maybe take a couple of shoulder rolls back, a couple of shoulder rolls forwards. Taking an opportunity to twist. I know you guys will be able to get up and shake your bodies and take a break, but really stay grounded and rooted in that knowing that your voice matters and the work that you're doing is extremely powerful. And as a fellow warrior, I am very thankful for everything that you're doing. Thank you for joining me for this break, this moment to pause, this moment to reflect, and really embody the spirits of all the warriors that we're fighting for, because this is a noble cause. Thank you.
All right. How is everybody doing? My name is John Otsuki. I am the Government Relations Manager at SCDAA, and I'm joined by...
Hi, everyone. My name is Emma Andelson. I'm the Senior Program Manager at Sickle Cells. Back to you, John.
Great. So we are going to be doing the Hill training today for the next 50 minutes or so, and then we will jump into our breakout room. So let's get going. So here's the agenda. For the first 30 minutes, we will be explaining to you what the federal priorities are. 20 minutes after that, we will be doing our meeting platform training, where we will show you how to use the meeting platform to be able to get into your meetings and to be able to use it most efficiently possible. After that, we will be getting into mock meetings, where Emma and I and some other members of the Sickle Cell staff will be doing some meetings to show you what it's like in preparation for tomorrow. And after that, we will go into breakout rooms where we will be grouped by region, and we can practice going through the meetings tomorrow and deciding who talks, and we'll get into that in a bit. So we wanted to start this off with a little bit of education. I'm sure many of you know these, but every advocacy day is somebody's first day. So here's some key terms. A legislator is somebody who makes laws. Other names include members of Congress, or a policymaker, or a lawmaker. You might hear senator, congressman, congresswoman, representative. Those are all legislators. Beyond that, the primary function of Congress is to create and modify legislation. Legislation is introduced as bills, and when those bills are passed, they become laws. So bills become laws, and Congress is the body that that all happens in. Legislative staff, or staffers as we call them, are staff hired by legislative offices to conduct research, draft legislation, give advice, and make recommendations. Likely tomorrow you'll be meeting with both members and staffers, depending on just what the schedule of the Hill is like. And a constituent is probably what you are. A constituent is somebody who lives in a particular constituency, especially someone who's able to vote in an election. So if you live, for me, I live in Maryland. So, I have a member who represents me in Congress, and two senators who represent me in the Senate. So, U.S. Government 101, the Senate. There are two bodies in Congress. They are called the Senate and the House of Representatives. Senate members of the Senate are called senators. There are 100 of them, with 2 per state. They serve 6-year terms, and they represent their entire state. 2 senators per state. Does not matter the size. Delaware has the same number of senators as Texas or California. The House of Representatives is the house that appropriations tend to start in, and it is the larger of the 2 houses. Members within it are called representatives, congressmen, congresswomen, or members of Congress. There are 435 members with varying members per state based on population. They serve 2-year terms, so everybody is reelected every 2 years. The last election was November, so the next election will be in November of 2024. And they represent a congressional district. The number of districts differs per state. Yep. So we have a new legislative request. We've been told that the Sickle Cell Disease Comprehensive Care Act will be reintroduced today. The sponsors will be Danny Davis, he's a Democrat from Illinois, and Michael Burgess, who is a Republican from Texas. And in the Senate, it will be introduced by Senator Cory Booker from New Jersey, a Democrat, and Tim Scott from South Carolina, a Republican. So it's a bipartisan bill. The bill will establish a demonstration program through the Centers of Medicare and Medicaid Services, that's CMS. If you hear CMS, that's what that is referring to improve access to quality care for SCD warriors enrolled in Medicaid. An identical version of this bill was introduced in December of 2021. So the language is the same as the bill from last year. It's the same exact bill. However, we will have to re-enlist all the co-sponsors that were on the bill last time. Those are no longer on the bill. We will have to get them back on board. The Sickle Cell Disease Comprehensive Care Act directs CMS to create a demonstration program in up to 10 states to improve access to comprehensive, high-quality outpatient care for sickle cell disease warriors enrolled in Medicaid. It will improve access to clinical, mental health, and ancillary and support services. It promotes coordination through multidisciplinary teams, provides support to community-based organizations, community health centers, hospitals, and academic health centers. And it will help develop infrastructure to recruit and provide specialized training. The appropriations for this bill are $25 million in planning grants and $50 million for CMS. So beyond that, we also have 2 other asks. They are appropriations asks. These will all be referred to as the FY24 asks because they are all for the federal government next fiscal year, which doesn't start until next year. Or I guess actually it doesn't start until October. It's not actually on January 1st. It's in October, the first day or last day of September. I can't remember which one. So first, we are asking for $25 million for the CDC's data collection program, and we are also asking for the $15 million for the HRSA demonstration program. We asked for both of those last year. You can keep going. That's A-okay. So I'm going to walk you through the 2023 Leave Behind. This is a document that you will have access to either in the materials that were sent to you or online as well. So first, the FY24 request for the HRSA Sickle Cell Disease Treatment Demonstration Program, the SCDTDP, if you will. Let's go through some terms real fast. HRSA stands for the Health Resources and Services Administration. SCD is sickle cell disease, as you know, and TDP is the Treatment Demonstration Program, which is what we're asking to be funded here. We actually go back one slide. I apologize. So the HRSA Sickle Cell Disease Treatment Demonstration Program is a HRSA grant program, which will have the following goals: to increase the number of clinicians or healthcare professionals knowledgeable about the care of SCD, improve the quality of care to individuals with SCD, improve care coordination with other providers, and develop best practices for coordination of services during pediatric to adult transition. The impact of this is continued program efforts will accelerate the identification and implementation of best practices and procedures for SCD care. And again, the request is $15 million. We understand that's significantly higher than it's being funded at, but we believe that in order for it to achieve its full potential, we need at least 15 million per year. We go to the next one. Thank you. So the next program is the CDC's Sickle Cell Data Collection Program, SCDC. The CDC stands for Centers of Disease Control and Prevention, and SCDC is what we call the Sickle Cell Disease Collection Program, but it's, Sickle Cell Disease Collection is what SCDC stands for. The SCDC program gathers health information from multiple sources to determine how many people live with the disease in a particular state. The SCDC currently covers 11 states with plans to expand due to the funding increases that were in part happened because of our advocacy efforts throughout the community over the previous years. And the goals of SCDC include learning where people with SCD live, gathering information on the transition from pediatric care to adult care, gathering demographic information, and much, much more. The impact of this is that data collection is necessary to improve national instances and prevalence data, better identify health disparities, and evaluate strategies to improve the quality of life and lower costs associated with treating the population. We have data collection, and having an idea of where people live is greatly important to research, to employing resources, to asking for other programs to be funded. It is a fundamental piece of infrastructure that we need to expand. That is why this is an important program to get behind. And the request is $25 million per year. We go to the next slide. This is to give you an idea of what the past few years have looked like in terms of funding. In the red, you can see the SCD TDP in the lighter red, and in the darker red is the sickle cell disease or sickle cell data collection program. You can see that the numbers have been increasing over the years steadily, but they're nowhere near our $15 million or $25 million asks. We currently, for the data collection program, we have $6 million annually, which is much better than $3 million from the previous year, but needs to be expanded if we want to cover the majority of states that have a high prevalence of sickle cell disease.
Great. I will jump right in. Thank you so much, John. And feel free to keep note of questions in the comments and questions section. We'll take a break after we walk through a couple more things to try to get to as many as we can. So let's go ahead and jump into some background information that was also included on that Leave Behind document you got. That's included in the program book, and maybe one of my coworkers can put the link for the digital program book in the chat one more time. But let's go ahead and get into it. So that's great. So John and I wanted to outline some important background information, especially in the realm of legislation, that you might hear talked about during your Hill meetings. So the things I'm about to outline right now, with one exception because of the new update for the Comprehensive Care Act bill, what I'm about to walk through right now are not included in our requests for this year, but they're very related because of past actions that have been taken. So when you're looking at this part of the Leave Behind material, it's noted as past federal support for sickle cell disease. So this section highlights two important sickle cell specific bills that were passed and funded at the federal level. And I'm about to walk through those two right now. So let's move forward one slide. First, many of you are aware that one of the most important pieces of legislation was passed in 1972, and it became Public Law 92-294. It was signed into law in May of 1972 by President Richard Nixon, and it was the first major piece of legislation for sickle cell disease, and it was sickle cell specific. And what it did, it established guidance for SCD education, screening, testing, counseling, and research. And it actually created the first ever federal programs for sickle cell disease. So at the bottom of this, you'll see that I noted that it was passed and funded. When any piece of legislation is created, and if it passes, it usually will stipulate a certain amount of funding. But the passage of that legislation doesn't necessarily ensure that it will be funded. It just essentially says that it can be funded. It's legally allowed to be funded. So the important thing about this bill was that it was not only passed, but it was also funded, which meant money was going to the programs outlined in the bill. Let's move forward one more. The next important piece, which many people on this call were involved in, the advocacy and raising awareness and reaching out to Hill offices during this time, was the Sickle Cell Disease and Other Heritable Blood Disorders Research, Surveillance, Prevention, and Treatment Act of 2018. This became Public Law 115-327. So this was signed into law in December of 2018 by President Donald Trump, and it was led by and sponsored by many of our standing sickle cell champions, both in the House and the Senate. So it was sponsored by Senators Tim Scott and Senator Cory Booker, as well as Representatives Danny Davis and Michael Burgess. This bill reauthorized the SCD prevention and treatment grants awarded by HRSA. So that's one of the programs that John just outlined, and it actually is one of our asks this year, like he said. What it also did was authorize the Centers for Disease Control, CDC, to award sickle cell disease surveillance grants to states, academic institutions, and nonprofit organizations. John also outlined that bill. So this bill, as you can see at the bottom, this piece of legislation was passed, but it wasn't actually funded until 2020, but it did get funded, and that is why there's continued federal financial support for these programs. This bill actually will sunset at the end of this calendar year. So if you have participated in past events of ours, our request language will look a little bit different because in the past we have asked for Hill offices to reauthorize this bill. This bill is sunsetting at the end of this year, which means the bill will be no longer active, but the programs will still be there and they will still be eligible for programmatic financial support. So let's keep going. Getting to the bottom half of that same piece of paper, these three bills outlined, which I'll walk through, highlight three bills that were introduced in 2021, but they actually died in Congress. And that means that they never made it to the point where there were votes taken in committees. And that's an important difference. If a piece of legislation fails, that means that it got to the votes, but it didn't pass the vote. This means that, for whatever reason, discussions took long. It was introduced later in the year. It didn't make it to the point where it got voted on. So it's referred to as dying in that Congress, but that's not a problem. While we would have loved to see them get passed and funded, they can be brought to our attention again in the new Congress. So moving forward one slide, this is exactly what we just found out. So Stephanie from ASH updated during the panel that the House and Senate are planning to introduce this bill in the afternoon today. And so for advocates on the Hill tomorrow, we'll get you an updated fact sheet and one pager for this bill so you can bring that to your offices and ask for co-sponsors. So the Sickle Cell Comprehensive Care Act, and we've listed the bill numbers there for both the House and the Senate, was introduced in December 2021 by Representatives Danny Davis and Burgess, and then in the House, in the Senate by Senators Cory Booker and Tim Scott. This bill, like John outlined, directs the Centers for Medicare and Medicaid Services to create a demonstration program. And like Stephanie outlined, it is mainly focused, though it supports lots of folks, but it's mainly focused on transition years and sickle cell warriors who are pregnant. So this iteration of the bill died in the 117th Congress, which was last year. Now we are in the 118th Congress, and we're really hoping that it will be reintroduced today, and we'll make sure to get in touch with all of tomorrow's Hill advocates with the updates in the appropriate language. So let's move forward one more. You heard Dr. Campbell mention a couple other pieces of legislation, and many of you are familiar with these either through your own participation in advocacy or maybe you attended one of the community workshops that John and I hosted last year. So another bill that was introduced last year but actually died in last year's Congress is the Sickle Cell Care Expansion Act. It was introduced in March 2022 by Representatives Christ and Lee in the House and Senators Van Hollen and Booker in the Senate. This bill is structured to increase the number of physicians treating sickle cell disease through a loan forgiveness and scholarship program. Again, this bill died in the 117th Congress, and while it may be introduced this year, I know that some of the Hill offices are still interested in this bill. It certainly has a great program outlined. It has not been introduced yet, and so that is why it's not being included in our asks for tomorrow. John and I will stay on top of this legislation and work with stakeholders across different groups. And if we hear that this legislation will be introduced later in the year, you'll definitely hear it from us. We'll likely have another opportunity to do a community workshop, and we'll provide guidance on the language and the ask to reach out to your Hill offices with. Let's move forward one more slide. Okay, I thought we were going to have the other bill on there. There we go. So this is the other bill that was introduced last year, and it also died in the last Congress. That's the Sickle Cell Disease Treatment Centers Act. Bill number is noted at the top, and it was introduced in September 2022 by Senators Van Hollen and Booker in the Senate and Representatives Lee and Davis and Adams in the House. So this established a hub and spoke model for caring for sickle cell disease warriors, and it also outlined collaboration efforts with sickle cell disease CBOs and nonprofits. So Dr. Campbell talked about this. This had an appropriations ask that was much higher than the other bills, and that was to accommodate the needs of the programs outlined. So like we said, this died last year. It is not, it hasn't yet been reintroduced, but John and I will be tracking this legislation. If we hear about it being introduced later in the year, we'll ensure that everyone who's interested in continuing advocacy knows the information they need to determine if they would like to advocate for this and what language to use with the offices they're reaching out to and what the direct request will be. Okay, I have a couple more things to get through, and then we will go ahead and pause for a couple questions that we may not be able to get all questions just because of the amount of material. So the last page that you'll see in the leave behind that you'll take to Hill offices this year is a sickle cell disease fact sheet. Let's go ahead and advance one slide. This fact sheet is broken out kind of into two sections. So the top section provides a basic description of sickle cell disease and notable facts about prevalence and treatments. So when you're meeting with your Hill offices, it will probably be a great idea to start off with just a basic description of what sickle cell is, because many of the offices you'll be meeting with may either be completely new to the Hill or maybe completely new to sickle cell disease. So it's a great idea to just start out by saying, hey, I would love to tell you a little bit about sickle cell disease if you're unfamiliar. Even if they are familiar, because there may be new advocates, it's still a great idea to tell them about sickle cell because they may learn something new that someone hasn't told them before. So this top part of the fact sheet is a great thing to use if you want a script, if you just want to keep it to a really easy talking point. You can reference this sheet for a description of sickle cell disease, quick prevalence data, and data on drugs and treatments that are available. Let's move to the next slide. The bottom half has a little bit more information about comprehensive care, standard of care, new treatments coming down the pipeline, as well as some economic burden of disease data, which is really important because while we're advocating for these programs or pieces of legislation, it's also really important to contextualize that in the experience of the sickle cell warrior, caregiver, and community. And this data really helps with this. There are some costs here down to the individual level, costs to the US government, and then costs in relation to other rare diseases they may be familiar with, just to help them wrap their heads around what the cost of sickle cell really is and why we need so much support. Let's move forward one slide. So those are sort of the biggest event resources that you'll be taking to your meetings. Those will be your leave behind materials, but we have a couple more support materials that will be helpful. The first one is this tips for meeting with your legislator virtually. It has quick tips for audio, video, and just sort of centering yourself. If you're feeling nervous, it has some quick tips on how to navigate that and ensure that you're bringing the confidence that we know you have to your Hill meetings. Let's go one more. It has a very, very important message at the bottom, and I really want to call this out. So we want to request that nobody records the meetings that are happening tomorrow on the Hill. You're welcome to take a picture, a screenshot of the meeting to share on social media with the permission of everyone attending, and that's super important. At the end of your meeting, the team leads will be in charge of asking, hey, can we take a screenshot? We would love to share this meeting on our social media, but it is very, very important to get consent and note that you are absolutely not allowed to record the meetings. Thank you so much for understanding. Let's move forward one more slide. Another support material that is really helpful is a toolkit to help you share your SCD story with legislators. If you're going to be one of the people sharing your story, completely optional, we'll leave it up to the breakout rooms to determine speaking roles. But this worksheet will really help you start from zero, think through what information is most important. It's downloadable, it's fillable, it's got 1, 2, 3, 4 steps, and it'll help you outline how you can craft a short, basically elevator pitch story to support the asks that you're bringing to your Hill offices. Okay, let's take a pause here before John and I get into more information related to the Hill. So, are there any questions about this year's asks? I know I have seen a few come through. So let's take a moment to address some of them. John, maybe we can do like, I do one, you do one.
Sounds good.
And if there are any questions about the Comprehensive Care Act, if Stephanie Kaplan from ASH is still in the audience, Stephanie, feel free to put some answers in the comments and questions, since I think you have the most up-to-date information. So I'll start with one question here that came through right at the beginning. So the $15 million ask for the demonstration program, that's the HRSA program, is higher than the ask of the $9 million attributed during Rare Disease Week. Were there changes in the demonstration program description? Great question. In short, no, there were no changes to the demonstration program description. It was mainly that upon revising the needs outlined by this program and then new discussions with key Hill offices that have provided language for this program in the past, the hosts of this event, so our 3 organizations, decided to update the amount for our Hill Day and the FY24 federal request. So it's a request number that they have seen before, but it is it won't be a surprise to them, and the funding, like John outlined, is definitely needed, and we know that all of you will bring amazing stories and data to support that request.
Okay, another question here. Could you please clarify what it means for a bill to be sunset? And I'll also say, does that mean that they're no longer law? And also, do all bills have a sunset? What it means for a bill to sunset is many bills have a built-in time that they are law. They're not all the same, but depending on the type of legislation, although many bills have a 5-year window of when they're authorized, they're active for 5 years. It's important that we continue funding these programs, they stay alive. And so that's what sunsetting a bill means.
Great, thanks. I think the next two, I'll kind of bundle those together like you did with the last two. So 2 related questions. Do you suggest bringing up the dead bills in Hill meetings tomorrow? And are we actively advocating for reintroducing Senator Van Hollen's bill? I believe that one is referring to the Treatment Centers Act. Great question. So yes, you absolutely can mention them. That is why we put them into the leave behind materials, because we think it's also important for the Hill offices to understand what has been done recently and opportunities for the future. Many of the offices working on bills that died in last Congress are actively working on reintroducing them. So like Stephanie from ASH said this morning, the offices that introduced the Comprehensive Care Act are planning to reintroduce it today. So that means they've put in work over the past couple months. I know our organizations have been involved, supporting where we can, providing information from the community side of things. Important to note, however, while you're definitely welcome to bring them up, we're hoping to sort of label them a little bit outside of FY24 asks, and I'll answer that in answering the second question about, are we actively advocating for reintroducing Senator Van Hollen's bill? So one thing that all of our organizations have discussed a lot in consultation with Hill offices, with other stakeholders and folks we work with in the policy and legislation space, all of the past legislation that has been passed and funded for sickle cell disease, so that's the bill in 1972, the bill in 2018, those have been bipartisan. And Ashley Valentine from Sickle Cells outlined that in her opening comments, how important it is that this issue remain bipartisan. It is not a political issue. It is not an issue just for Democrats to work on, just for Republicans to work on, just for independents to work on. It is an issue for everyone to work on. And so when we're talking to Hill offices, one of the messages that we're bringing is that we really want to ensure that the legislation is successful. In order to support the needs of the community, a successful bill will largely mean that it's a bipartisan bill and has support from different parties and folks with different backgrounds and interests. So in answering the question, are we actively advocating for reintroducing the Senator Van Hollen bill? All of you are in those meetings. We're providing talking points. You're welcome to come up with additional talking points that are really important to you. I would just make sure, say that maybe we would practice them as a group in breakouts, see how your team feels about them. It's going to be a team ask. The important thing about advocating is that for those bills, we want to make sure that there's pretty even support from both sides. And the representation we have on the Hill tomorrow is not exactly split between political parties. So I think it's a great idea to educate them on something that has happened last year and say, we would love to see these reintroduced, but for our purposes for this event, that request is not an official FY24 request. John, do you want to add anything to that? Did I sum that up?
Yeah, I think you did a great job.
Okay. Let me see.
I can take the next one. Did we find out why the previous bills died in Congress? So the previous bills died in Congress simply because they ran out of time. The clock stopped and the year turned over, and we're in a new Congress now. Last year was an election year, which sort of takes away a good bit of the calendar and time for advocacy. One of the bills was introduced in September, which was only 3 months before the end of the Congress. So it's difficult with that restriction on time to be able to pass the bill. You'll note that the bill that got the most support, the Comprehensive Care Act, was introduced in September, or I think December of 2021, if I recall correctly. And that's only a year out as well. And there was an election. The other reason is we need more. So when a bill dies, it doesn't mean it's gone forever. It just means that it was not voted on in Congress. It can be reintroduced. It can become alive again. It's not a terrible thing at all. So it only died because the clock ran out. The time ended. Congress switched to a new, turned over. There was an election. That's the only reason. And we hope through this event that we'll be able to generate more support, more co-sponsors for it to get further in the political process and eventually become a law.
Awesome. Thanks, John. I'll answer one more quick question. I see so many good questions coming through. I encourage you all to, after John and I are done doing the overview, go into your sessions, which are breakout rooms. There will be staff supports in there to hopefully continue answering your questions. If they're unable to answer the question, they'll check back with the rest of us and we'll get answers to you either way. The last question we are able to answer before moving on to the next segment is, how can we gain more bipartisan support? Should we be calling or doing a letter campaign to our senators? That is a great question. And I think it's so timely because guess what? So many of us are going to be on the Hill tomorrow and we have meetings with Democrats, with Republicans, with independents, with lots of different people. The best way to gain bipartisan support is by making sure we're paying attention to all people on the Hill who could have a vested interest in sickle cell disease. Maybe they've worked in Medicaid. Maybe they've worked in rare diseases. Maybe they have a personal connection to a rare disease. Focusing on, hey, I think my legislator had a program for the community that helped support paying for medical costs or something like that. Thinking through what personal connection you could have with that office. A huge part of creating that connection and gaining interest and sort of really getting the point across that these are crucial, time sensitive, and can be life and death issues is by sharing your story. And that's why we're going to take a lot of time today in our breakout rooms to make sure you all feel comfortable with the asks and coordinating talking points with your team. Sharing your story is a super powerful way to get the point across of how these programs could impact your life or a loved one's life. And you can do so if you're a sickle cell warrior, a caregiver, a friend, family, advocate. You can contextualize that for them and help them understand. And I think that is the best way to gain bipartisan support, is by putting the community at the forefront and ensuring that the community's voices and the needs are coming through. I think another thing is just making sure we're not automatically ruling any offices out. There are a lot of offices that came in new this Congress, and so it's a wonderful opportunity to sit down, do some research. I know John and I have been doing that, thinking through like, hey, who's new this year? Who haven't we talked to before? Who have we been trying to get interested in this cause who maybe hasn't, we haven't hooked them yet? Who's the opportunity with? And that's something where I know John and I are happy to support. All of our organizations can support. If you need a little bit more assistance in finding information on your legislators, we're happy to help with that. But I think pairing what we walked through with our federal requests with your story. And then if you have data to contextualize that, you know, across the whole community or across the whole country, that's a really powerful way to ensure that no matter who you're speaking to, no matter what party they belong to, it's a message that can resonate with anyone. So I think it's time for us to move on to the next section. Hill Day platform. I will go ahead and jump right into this. So as John mentioned at the beginning, for those of you participating in Hill meetings tomorrow, we'll walk through getting into it in this section. So this is a note that if you did not sign up to participate in the Hill Day, you will not have received the email outlined in this. You won't have received the link. So I just wanted to put that out there. So let's keep going. So everyone who registered for Hill Day meetings received an email on March 14th, which is last Tuesday, around noon Eastern, with your schedule. And we'll share this link when we're in the breakout rooms, and you'll have dedicated time to make sure you can get in to see your schedule. So they shared a link in there, and that is where on that platform, which is different from this platform, that is where you'll get access to your meeting schedule for tomorrow, any meetings you have, and you'll be able to see who your team buddies are. Let's keep going. So when you get to this page, you click that link. The username is the email you use to sign up. If you have any questions, reach out to event staff and we can help you. And the password is one that you set. So when you go to that login page, if you're having issues getting into it, that will largely be for the platform IT staff to support. There's a support button with a little question mark. When you log in, if you're having issues, hit that button and they'll be able to help you get in. Once you're inside the platform, you'll see on a sort of across the screen menu with a couple different buttons. If you hit home, that is where it'll take you to sort of your default full schedule. Meetings, when you click that, it's basically the same view as home. It's just going to show you your full meeting schedule, you know, the offices you're meeting with, the time, and quick information. When you click legislators, that's a really great spot. And I super encourage you, this kind of goes along with what John and I are saying, and just sort of ensuring you're contextualizing your story, the data, the asks, in the interest of those offices to help them understand that they actually do really care about this cause. So if you click legislators, this gives you background information on all the offices you're meeting with, which is a really great way to just do a quick scan through and say, oh, this legislator worked on this cause. That's relevant because X. If you can bring that up in your meeting, it'll show that not only you have done your research and you're interested in them as your policymaker, as your legislator, but it'll maybe prompt a thought in their mind of like, oh yeah, that is related. It does make sense for me to be involved. If you hit messages, you'll see relevant notices here. This will be about the event or your meetings, any meeting changes, because there can be day of meeting changes. If you hit directory, it allows you to send messages to other advocates signed up for Hill Day. It's a great it's a great way to connect with those on your team. And then support, like I said, technical support will come from advocacy associates, not event staff. If you're really having issues, we'll try to help, but I'm going to be honest, we can't get into the back end of things, and they're going to be the ones who are really going to be able to solve tech issues for you. So when you log in, you've gone to the home page or you've gone to the meeting page, you've clicked, I want to learn more about my meeting with Representative Barrymore. Just to know that this is a screenshot from a previous event, so the dates are not correct, but the view is still the same. So when you log in, you click on your meeting with Representative Barrymore. Right next to their name, it will tell you what party they belong to, what state, and if it's a representative, what congressional district. Under that, it'll tell you who you're meeting with, and that means that if the member is not available to meet, it'll outline their staff. I think if you go to the next slide, it'll be like a little box outline. Yes. So where this yellow box pops up, this is showing you how you actually get into your meeting. That big green button that says join online meeting, you hit that, that'll take you into your Zoom meeting. If you're having video issues or bandwidth issues, anything like that, there's also the dial-in number, which you can put into your phone and you can join without your video. The access code is also included there. So under that is just like a little bit of information. Sorry, thanks. A little bit of information if you're having Zoom issues, but again, you can reach out to support staff and we'll make sure we're available to help problem solve as well. Top right, talking points. This year's asks will be listed here, and there might be a couple office-specific notes. I know based on information that has been shared, we're updating the talking points to include a request for the Comprehensive Care Act, but there might be some information like we noted if you're meeting with a standing sickle cell champion, a quick note that, hey, thank their office, thank their legislators for their past support. They've been a key stakeholder in support for sickle cell disease, and we've outlined why that is. Next slide. Documents. This year's materials will be linked here. So in this area of the landing page for your meeting, it'll have, I'm going to see if I can remember the list. It'll have the FY24, which is this year's federal requests. That'll be the 3-part PDF that John and I walked through with this year's request, information on past legislation, and that sickle cell disease fact sheet. There also will be links to the support documents. So the share your story document, the team lead document to just help refresh your memory on as a team lead, what are you doing? And tips for meeting with your legislators virtually. Next slide. Bottom right, so you've scrolled down a little bit on your meeting page. Under attendees, you'll see your meeting buddies. These are the people who will be in your meeting. Just a note here, in our breakout rooms, we're going to confirm folks' attendance, but note that there may be day of changes. If someone has a health issue come up, we're going to accommodate that and make sure that they're able to have a Hill meeting after tomorrow, when they're feeling better. There are some meetings that have fewer attendees, and we're going to plug in some staff support if you would like it. But just to note that this is a great area on your screen where you can see who's in your meeting, who should be attending, and then if you click the little bubble icon, you'll be able to send a message to them. Last thing, post-meeting actions. You can copy and paste our pre-written thank you note, which will be automatically populated when you hit the button that says send thank you note. This is a request specifically or especially, I suppose, for team leads. It's super important that the team leads are on top of sending a thank you note and then filling out that meeting report form. The report form just lets us know, hey, was everyone from your team there? Did the office show up? What was their reception to your idea? Did they ask you any questions you were unable to answer that we need to follow up on? Things like that. There's also a little white button there that says take notes. That's a great place to just record your notes, but know that the notes that you take will not be shared with event staff. So if it's really important information, definitely include it in the meeting report form. And then you can also check, because these things change day of, check if the member attended. So that means did the actual representative, did the actual senator attend, or on the right, staff attended. I feel bad that it says only staff because we love meeting with staffers. They're crucial parts of the offices. So it is exciting regardless of who in the office is hosting the meeting. It's exciting regardless because we're very happy to meet with them. One more slide. Then at the bottom, if you hit tweet, Facebook, or LinkedIn, it'll auto-populate some text that you can share on your social media page. So we will share this information again with all Hill Day attendees, but there are a couple different ways that you will be receiving support. If you have a technical question, like my portal has a bug, that platform isn't working, maybe the office didn't show up, you will be reaching out to Advocacy Associates for immediate assistance. You can either request support through the web portal with the buttons that we showed you, or call their support staff directly. On the other hand, if you have questions about the Hill Day, like talking points, or if you have a medical emergency and you cannot come to your meeting, you can let event staff know by emailing any or all of the 3 emails below. Probably best to email all 3 of them. We'll have a lot of movement that day, so we want to make sure we can accommodate the issue you're having. And whatever issue you're having will get directed to the person who can best support you. Okay, let's pause here. I think we're doing okay on time. We have one more segment, and then keep in mind that we will be walking through this and you'll have plenty of opportunities to ask these questions in the breakout sessions. We'll share information about office hours tonight. There's still lots of opportunities to get questions answered, but let's take a pause here to see, are there any questions about the Hill Day meeting platform or viewing your schedule? I haven't seen any come through the comments. I'll give it 30 seconds just in case, but this is also not the last opportunity you have. We'll have time for more questions after our mock meetings. Comment come through. Okay, there is a question here. I know this attendee, I'll go through this question because it may be relevant to others. The question that came through was, I may have missed this, but who leads the Senate meetings when all team leads are present? Maryland, for example, has multiple leads. So in meetings for the full state, you're going to notice that the senator meetings are much bigger than representative meetings because the representative meetings are broken out into congressional districts. So it's going to be smaller teams. For each meeting, there is a designated team lead. For Senate meetings, there will still only be one team lead that's written in the platform. When you meet with your team to discuss in the breakout rooms, you guys can feel it out. You know, if the person assigned team lead wants to hand it over to someone else who's super excited about being team lead, that's fine. But point being, for senator meetings, when you have multiple team leads from other meetings in the same place, one of them will still be the designated team lead, and that is reflected on your schedule. That will be noted in the attendees tab. Like I said, you can discuss it with your team in the breakout room, but there will be one noted team lead for each meeting, and we will actually be having some practice sessions here with mock meetings, so you can see what it's like to be a team lead. It's not necessarily like the team lead isn't doing the entire meeting. They're just doing the intro, making sure those who want to talk get a chance to talk. So you guys will figure it out in your state breakout rooms, I am sure, but we are here to support. Okay. I haven't seen any other questions come through, so let's go ahead and keep going. And I think I'm handing it back to John.
Yes, I believe we are. Was there a slide here that we were supposed to discuss about team leads, or?
I think if you go forward, there we go. Yeah.
There it is. Sorry. Team leads, I just wanted to discuss this with you all before we get into our mock meetings. Team leads are in charge of coordinating speaker roles during their Hill meetings. They're in charge of managing their meetings, reporting meeting details to event staff, taking screenshots, engaging on social media offices, and following lead document, which was provided to you all in the materials. So the team lead role isn't just, as Emma said, isn't to be the only person who participates in the meeting. It's to facilitate the meeting, to move it forward, to make sure everything's running smoothly, to make sure the people that need to talk and tell their stories, and to follow up on the back end and make sure everything works. It's just an organizational tool. But yes, we have a document that it's important to attend all your meetings, to look over the meeting materials beforehand, especially the one-pager outlining our request, to practice in the breakout rooms in a few minutes, to start the meeting, to guide the conversation, and to make sure people who want to speak actually get to speak. And it'd be great to take a screenshot and to follow up after the meeting is over. And we can go to the next slide. And reminders for the meetings: do not repeat negatives. Bridge to key messages. This year's ask, that means when you're telling stories, make sure you could try to connect the stories with what we're asking for, if you can. So if a member of your group does a great job telling their personal story, it's great to sort of move that emotional story and try to connect it with what we want to talk about on the Hill. You want to stay confident. You want to be clear. And it's a-okay to say, I don't know. There'll be plenty of questions that staffers will ask that maybe are too in detail. You might just not have the information to ask. 100% okay to say, I don't know, or I will follow up later with your office. That is very acceptable to do. Reminders for the meetings. When you are working with media, you might encounter situations you don't feel prepared for. You can hear some tips that you can maintain control of your situation. You can say that's one view, but you know, if you could say that's one view, but your readers would probably be interested to know that blank, blank, blank. I think what you're trying to say is blank, 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 or I don't think I have the information, but let me tell you who does. And I'm not sure I'm the right person to ask, but you could ask, like, you don't always have to be the person. You don't always have to just straight up ask and respond respond to any of the questions that are presented. If you don't have the information, or if they're a little bit, uncomfortable, you can sort of redirect them in a way that's more positive, that takes the conversation into a more collaborative mode, rather than into a more, a confrontational situation. All right, we're going to do a little meeting here. I'm going to be a legislator or a staffer. I'll be a legislative aide from Congressman Jones's office, and we're going to talk to Corey and Elodie here. They're going to be the team lead and the attendee. Elodie will be the team lead and Corey will be the attendee. So y'all want to get going? You ready?
Let's do it.
Fantastic. Thank you for meeting with me. I don't know much about sickle cell disease. I'm a staffer for Congressman Jones's office. I'm a legislative aide for Congressman Jones's office. What can I do for y'all today?
Well, thank you, John, for having us today on this meeting. My name is Elodie Antala. We're here to talk to you about sickle cell disease. And we'll just start by giving you a few quick facts about what the disease is. And then we'll have Corey share his story with his own personal story with sickle cell disease. So sickle cell disease, or SCD, is a disease that is the most common inherited blood disorder in the US. 1 in every 365 Black or African American births have sickle cell disease, or 1 in every 16,300 Hispanic births have sickle cell disease. At the federal level, annually, it costs $2.98 billion for the federal government to care for people living with sickle cell disease. And at the individual level, it amounts to about $10,000 in income loss for people living with sickle cell disease. So we are here in front of you to bring attention to this disease and ask you to take action. And now I'll turn it over to Corey for Corey to share his personal story with this terrible disease.
Thank you so much. Again, my name is Corey Lewis, and I live with sickle cell disease. Thank you for taking the time out to speak with us. I just wanted to, go over a few things with you on my life with sickle cell. I live with sickle cell disease SC, and sickle cell is known to die early, which causes a constant shortage of red blood cells. And they're known to travel through your blood vessels, and they get stuck and they clog the blood flow. And this can cause pain and other serious complications, such as health problems like infections, acute chest syndrome, and a stroke. So you can imagine how this disease can disrupt the quality of life for many individuals. Me, as a 29-year-old living in the state of Georgia, I have been challenged in many ways when it comes to healthcare. A huge problem was access to healthcare through my transition journey from childcare to adult healthcare. And I've learned so much living in Georgia, just being older. There has been many changes, and I've experienced getting Medicaid and SSI being revoked from me as soon as I moved to the state of Georgia. And I could not make over $1,000 to receive these benefits. So this caused me a lot of confusion as a child growing from transition stages, coming out of child healthcare to adult healthcare. And a lot of trials, as I was not equipped to get the medical insurance through my employer. So working side jobs at a young age, money was not the easiest to make with just one job. However, this burdened my body so much more, and it left me to care for myself at home when I shouldn't have to. So to make matters worse, when I would visit the emergency room, I would always experience doctors not being knowledgeable about sickle cell, and it made healthcare just very stressful. So Georgia is the home for the 4th highest rate of uninsured people in the country. However, most of these Georgians work in low-wage jobs, so we are not offered health benefits as much as others. And I ask that you prioritize expanding that access to health insurance for most Georgians. Most other states have already expanded Medicaid eligibility, but putting on insurance cards and you got these putting it in the pockets of the residents. I just want to be able to do that for the people in Georgia.
Senator Jones's staffer, you muted yourself. I don't remember if you were a
I
senator.
sure did. That will absolutely happen in a real meeting. But anyway, back in character. Thank you so much for telling your story. That's very difficult to hear. Are there any? My boss is very interested in health equity issues on the Hill. You mentioned access to insurance. Are there any other priorities our office can support, and how can we support them? Do you know who we should reach out to if we have any questions?
Yes.
So, go ahead, Corey.
Go ahead. So you don't need.
Sorry, character. Yeah, so today we are actually bringing two federal priorities in appropriations asked to your office. The first is the HRSA sickle cell disease treatment demonstration program. And this we're asking for $15 million to increase the number of clinicians or healthcare professionals knowledgeable about sickle cell disease, especially as it relates to adult care. As you've heard from Corey, his experience has been challenging, and it has been difficult for adults specifically to find knowledgeable hematologists to care for this disease. Overall, this project would allow more clinicians and more professionals to be able to understand the disease and care for the sickle cell disease population in a more compassionate and efficient way. And secondly, we have the sickle cell disease data collection program with the CDC. And this project has been running in 11 states currently, and we are asking for $25 million. With this CDC project, the goal of the project is to include learning where people with SCD live, gather information on transition from pediatric care to adult care, and gather demographic information and much more. This project, with continued funding, can not only help us identify the aforementioned, but provide treatment to those who have not yet been able to get proper treatment across the United States in specific states.
Excellent. Well, I will bring those policy priorities and appropriations asks to the congressman. If we could possibly, in the future, if there are letters, sign-on letters, if there's anything else you want to send our office, we'd be happy to take a look at it. It'd be great to follow up in the future. And if we decide to support these programs, we will be in touch. Thank you very much.
Thank you. We will leave these one-pagers behind for you to show to your member. It has our federal priorities asks, as well as a one-pager with more details on what sickle cell disease is. Thank you again for meeting with us today.
Thank you so much for your time.
Thank you.
Great. And that's mock meeting number 1. Now we're going to move into a slightly different mock meeting. I don't know if you have to pull up the slides. I can just sort of say. So the next meeting that's happening, I will pretend to be the legislator or the staff. Okay, there we go. Perfect. So in this meeting, I will be the legislator staffer. In this one, Corey will be the team lead, the one sort of managing the meeting. Elodie is going to share her story. In the last meeting, you kind of saw how I was participating like as a silent attendee. So if you're thinking about tomorrow, you're signed up for Hill Day. If you don't want to share your story, you don't want to make the federal request, if your team is big enough and other people can accommodate those roles, it's absolutely fine for you to attend as a silent attendee like I did. But we still encourage you to introduce yourself because you're a super important part of the meeting, because you're showing that the community is here, we're listening, and we're showing up. So without further ado, let's transition into meeting 2. And I will get into character. John left. Maybe he doesn't want to meet with me. That's fine. So, he's back.
I'm back.
Okay. We've got 3 meeting attendees. Hi guys, thank you so much. My name is Emma Andelson. I am the legislative coordinator for Representative Glass. Thanks for taking the time. I'm really excited to hear what you have to say.
Hi, Emma. Thank you so much for taking your time to talk to us today. It's definitely an honor to be in this opportunity. And this is also a first time for a lot of us on the platform as well. So we definitely are looking forward to, having a great conversation and making sure that we get our ass out there for you. So again, my name is Corey Lewis, and I just kind of want to jump into sickle cell disease. Sickle cell disease is a huge issue for a lot of the African American community, especially in the United States. And this is something that we kind of all have been dealing with, especially when it comes to sickle cell disease treatment and demonstration, or even collecting the data with sickle cell disease. And I feel like this is an opportunity for me to allow you to hear other warrior stories, so we can try to see how we can alleviate a lot of these issues that we have in the community today. Here with me, I have Elodie. Elodie, would you like to share your story with Emma?
Hi, thank you, Corey. Hi, Emma. It's great to meet you and having the opportunity to share my story today. So my name is Elodie. I'm from Milwaukee. I'm born with sickle cell disease. And as a person with sickle cell disease, I experience extreme pain every day, long hours in the emergency room, and I have missed weeks and sometimes months of work. And on average, an adult living with sickle cell experiences an income loss of about $10,000 per year. And with lack of Medicaid support and SSI coverage, adults living with sickle cell disease are unable to access the care that we need every day. Personally, in 2017, I experienced a stroke. And while the stroke happened in my eye, as I got to the hospital, I was not cared for because I was physically fine, except I was blind. And I woke up one morning, I was blind. I got rushed to the hospital, and the clinics took their time in identifying what my issue was. I got to the hospital at 6 a.m. I was tested at 11 and was diagnosed at 3 p.m. with what they called an ocular occlusion, which is basically a sickle cell crisis in my eye. And that rendered me completely blind. And while I was able to receive some sort of care in New York, at the time I was living in New York, I was sent back to Wisconsin. And because Wisconsin has currently, I guess, the best center to treat people with sickle cell disease and their issues with any sort of eye problems. And so they were able to identify what happened to my eye, and that's how they knew that it was sickle cell disease. However, when I got to New York, I didn't have the complete care I needed to treat my eye and the symptoms that I had experienced. So today, I'm asking for your office to support the Sickle Cell Comprehensive Care Act, as it will allow CMS to create a demonstration to improve access to quality care for people like me, and provide and support for people like me who have needed and are on Medicaid. So thank you for listening to my story today.
Thank you so much, Elodie, and thank you for sharing your story. I'm really sorry to hear that that is the treatment you received, and my boss is actively working on different pieces of legislation to improve healthcare overall, but I will definitely bring this to her attention, because I think she hasn't been involved with sickle cell before, but it sounds like something that's really in line with what she is trying to do. I have a question maybe for you or Corey. I'm not sure I quite understand exactly how sickle cell can impact someone. Can you just tell me a little bit more about what you mentioned and what you referred to as a sickle cell crisis?
Sure. So sickle cell disease is a rare genetic life-threatening blood disorder that affects every organ in your body. So just understand that, it's caused by abnormal red blood cells in the body. So instead of your blood cells being round and softer, sickle cell warriors experience blood cells that are more of a hard and sticky texture, where the shape is it's like a sickle shape. And that could actually block blood flow and cause oxygen from reaching to other body parts. So this right here is a really huge part of pain crisis for a lot of different warriors. And there are over 100,000 individuals with SCD in the United States. So 1 in every 365 Black African American births, as well as 1 in every 16,300 Hispanic American births. That right there alone can already show you that there's a lot of people who are experiencing chronic complications, and such as Elodie, when she mentioned about her eye, these are issues that we are dealing with, but these are limited treatments that we also have as well. So really getting you guys to tag along and really help us with funding, understanding that cost is a big thing when it comes to sickle cell and living with sickle cell. And I feel like that's the biggest ask as well, is funding, knowing that we have cystic fibrosis, we have hemophilia. There are other rare diseases out here that do have great standards of care, but when we look at sickle cell disease, we need to be able to highlight that as well.
Yeah, I hear that. My boss has worked a lot in cystic fibrosis, and so I'm somewhat familiar with the support and treatments available for that rare disease community, but I wasn't aware of the current state of sickle cell care and treatments. I have one question. I'm not sure if, Corey, Elodie, or John, if you would like to answer. So Elodie, you mentioned a bill called the Sickle Cell Comprehensive Care Act. Do you know, can you list all of the sponsors and representatives who are the senators and representatives currently sponsoring, and can you let me know the history of the bill sort of and where it came from?
So I'll be honest and let you know that I am not sure about the history of the bill. However, we do have a one-pager that Corey has that we will be leaving with your office for you to have more information on the history of the bill and our other asks.
Great, that's not a problem. I really appreciate it. I'll be sure to take a look at that information. I don't think I have any further questions. I just want to thank you all for your time. I really appreciate you sharing your story. Thank you for taking the time meeting with me today, and please feel free to reach out in the future. I think you have my email. I would love to stay in touch and learn more about how, did I say she was a representative? I think I said Representative Glass can support this issue.
And we definitely appreciate you as well, and we will be sure to follow up with you because we do look forward to meeting with you again. So I appreciate you. Thank you so much.
Thank you.
Thank you for your time.
Wait, can one of you ask to take a screenshot?
Oh, that was so can I just say
You're
something?
the team
Can I just
lead.
say something? That actually is something that I usually would say in the beginning. And a lot of times it's kind of like a little icebreaker sometimes when you ask to take the picture with the staffer, because it kind of get the meeting, everyone feels a little more comfortable. But sometimes, yeah, you do forget to get that picture at the end because everyone is kind of like, I said it, I'm done, Yeah. So maybe kind of offering that in the beginning, I feel like will be helpful, because sometimes you just want to get that moment out of the way.
Yeah, no, that's a good point, Corey. I'm not talking as a legislative coordinator anymore. This is just me, Emma. I think that's a great point. And that might be a good tactic for others to take into their meetings. We have a few minutes for questions about mock meetings. After this, we'll be going into our breakout rooms, and John and I will explain exactly how to do that using a few quick slides. So while we're going through and talking through how to get into your breakout rooms, you can go ahead and pop any questions into the chat. Elodie and Corey, thank you so much. See you later. John, you want to take us through after we go to the next slide? I think we have some instructions on how to find the breakout rooms.
Absolutely. We're going to be looking at breakout rooms now. Connect with your state team by heading to the session that is relevant to you. We can go to the next slide. So there are 14 breakout rooms according to your state or geographic region. As you can see, they're listed here, all 14 of them. Some states are big enough to be on their own, and some states have a cluster of groups together. We have a limited number of staff, so we couldn't have a room for every single state. We apologize for that, but we'll be bouncing around in between these different rooms. We can go to the next slide. So yes, so 5 states will meet as independent breakout rooms. That's New York in room 2, Maryland in room 5, Georgia in room 6, Florida in room 8, and California in room 14. We can go to the next slide. And then there'll be 9 regions which will meet in combination with other states. There's the Northeast, which is room 1, which is part of, if you're from Connecticut, Massachusetts, New Jersey, Pennsylvania, and Rhode Island, you would go to that room. There's the Virginia and DC room, which is room 4. There is the Southeast room, which is North Carolina, South Carolina, and Tennessee, which is in room 5. There is the second Southeast room, which is room 7. It's Alabama, Arkansas, Louisiana, and Mississippi. There's the Midwest room, room 9, Michigan, Minnesota, and Wisconsin, and a second Midwest room, room 10, Illinois, Indiana, and Ohio. And then there's the Missouri and Kentucky room in room 11. That's Missouri and Kentucky. Then there's the Texas and Arizona room, room 12. And then there's the West room, which is room 13, which includes Colorado, Idaho, and Nevada. So the goals in our breakout rooms, once we leave and go to them, will be to confirm day 2 attendance, confirm the team leads, to check the Hill Day schedules, to establish speaking roles. There'll be 1 team lead, 2 personal stories. It doesn't have to be 2. It can be 1, it can be 3. 1 person per ask. Also, if one person's more comfortable, one person can do all the asks, or you can split it up. There's no hard and fast rules here. You just want to be able to discuss them beforehand. And if you don't want to speak, or you just want to observe and be in the room, definitely let folks know so you can establish that, and people won't have the expectation you're going to be speaking. So in order to get to the breakout rooms in the platform that we are currently in, you click on sessions on the left. It'll be this below stage and above networking. And you can find the state that you are a part of in the region, as was just listed. So go down, figure out which state you're a part of, and click on that room. Make sure your audio and video are enabled. Might be these pop-ups in the bottom left and the bottom right. And if you can't speak, there is a chat on the right. If you're having audio issues, there's a chat on the right side of the page which you can participate in, which will also tell you who's in the room and whatnot. And session info. Sessions will stay open and accessible for 2 hours after the event in case your team wants to use them to coordinate and practice. So if you guys want to meet back up, you run out of time here and you want to say, oh, well, I'm not comfortable, let's meet up again after the event is over, you can still go back into your room. And you're also welcome to come to tonight's office hours from 6 to 8 p.m. I did the office hours last night with Ariel, and it was fantastic. You can go in, have a conversation. If you have any concerns, just pop into our office hours.
Thanks, John. So let's go ahead and get into our breakout rooms. What you'll do when we're finished talking, we'll give you a couple minutes. We won't start right away. We'll give you a couple minutes. You'll leave the main stage, go to your session. Just a note here. So the sessions, these breakout rooms are really intended for those who are participating in the Hill Day. So the team leads and the advocates going to the Hill. If you're not going to the Hill, we welcome you to go in there and observe if you wish. But just a note that we really want them to be able to use this time to do the practicing that they need to do, and make sure that they have the time they need to coordinate. Like John said, we'll share some links at the end of the day here to make sure you can sign up for office hours if you want. But we'll leave this up here for another 30 seconds. When you go to the sessions page, this information is also listed there. So you can just scroll down. The sessions are listed in number order. And then if you can just remain patient with event staff, we'll be floating between rooms. We'll have to start in one of our 2 rooms, and then we'll eventually make it to the other one. But that's note that team leads, if staff is not in your room yet, go ahead and start. We suggest that you start with just making sure that the team lead is identified, whether that's you or someone else, confirming availability for tomorrow, and then figuring out speaking roles. But again, we'll be popping in to help make sure you guys are navigating the conversation and to answer any questions. So with that, I think everyone can go ahead and leave the main stage, go to the left side menu, click sessions, and find the room with your state listed. And at this point, we'll stop the main stage broadcast, but we'll resume right at 2:40 for the next generation and closing comments. Thank you so much.
Hi, everybody. Welcome back. I hope your breakout rooms were productive and you team leads sort of figured out who's on their teams and everything is in a good spot for tomorrow. Okay, well, we're going to hop into the next event we have here. I'm happy to take us into the last segment of today's virtual event, a message from the next generation. Micah, Jaden, and Ayana are three inspiring young sickle cell disease warriors and advocates who are dedicated to raising awareness for sickle cell disease. Please enjoy their message as we prepare for tomorrow's virtual Hill Day.
Hi everybody, it's me Micah, I'm 10 years old and I'm from NYC. I want to advocate for sickle cell because I want to help people and I want to ask scientists how. And I want to help more people by getting more hospitals, and I want to make the hospitals fun and exciting. So I want to find a cure for sickle cell and knock it all down altogether. Signing off, Micah J.
Hello, my name is Jaden. I'm 15 years old. I have sickle cell SS. When I was younger, I felt more alone in this journey because I was the only person around my age that I knew of that had sickle cell. And while I was watching all of these more experienced warriors fighting, I got to learn from some of them, but I was still missing that camaraderie that came with people of my age. And I just want to make it known that to other people around my age group that you're not the only one dealing with this. And although your friends and everything and everyone else like that are playing sports and different things like that, and you're in the hospital, you can still enjoy and be who you are without having to compromise.
I am often asked why I am so passionate about advocacy, and I always have the same exact answer. When you are first faced with the truth of what having sickle cell disease can entail, the most important thing you should do is focus on yourself and do what you need to do to get through that initial experience. We are all different, and only you will know when it is time. But at a certain point, everyone realizes that they themselves are a major part of their experience and can look back with a different lens. At that time, each person needs to decide for themselves how they want to move forward. For some, they never want to think about sickle cell disease again, and for that, I do not blame them. For others, like myself, it was important to try to do what I could to help others. I think the best way that anyone can give back is first to donate and or fundraise for the organizations that helped you when you needed it. And second, to tell others about the organizations that helped you and why. We are all called to serve in different ways, but what matters is that you show up when you are called.
Well, that was wonderful. Today, we laid the groundwork for a successful Hill Day and expanded our community's tool to advocate for sickle cell disease policy at all levels. I know that tomorrow we will have a powerful day advocating for the resources and infrastructure that we need.
Remember, you have a right to comprehensive health care, and now is the time to work with your legislators to make it a reality. We hope you take the skills you learned today and the experience you will gain tomorrow and apply them to the sickle cell legislative movement at your local and state governments.
And it was so inspiring to hear from the next generation. I was quickly writing down here, we're all called to serve in different ways, but it's important to show up when you're called. And that's just what we're doing here today. So if you have any questions about our Hill Day tomorrow, please join our office hours this evening from 6 to 8 p.m. Eastern Standard Time. I think someone from the staff will be dropping that link into this chat. Likewise, you've received some emails about it. On behalf of Sickle Cells, the SCDAA, and the Sickle Cell Disease Consortium, we're so grateful that you decided to join us today, and we are really excited to see what you can accomplish tomorrow. Thank you so much.
Thank you.
Thank you.